Minister is around. She's just on her way downstairs, and then as soon as she arrives, we will be ready to commence with our program. They say today is Friday. We must make sure that when we go on break, when we start on time, so that Mr. Pierre and his team doesn't steal our Friday time. You know, they say public servants know the watch when it comes to Friday. Yes. I do hope that all of us have actually learned quite a lot yesterday from our engagement with the different speakers and with the different. Did we enjoy the stand outside where they were giving us some information? Oh yeah. Oh yeah. Oh yeah. Oh yeah. But there's a gap here, and our gallery today is not that full. And the gallery people, you are also welcome this morning. And I do hope. But if there is space in front, those right at the back, you are taking your seats of yesterday. You don't have to take your seats of yesterday. You can still come in front so that you can be able to engage. I was looking at the app, and I see that many people are not making comments there. There's very little engagement on the app. Is there people who have got a challenge with engaging with the app through the app? You should even be able to communicate with other people there. Make new friends. Make new friends there on the app. Okay, in the next 30 seconds, we will be starting. I had just had a whiff and saw that the Deputy Minister is just about to enter the door. Together with Uom Pierre. Yes, he likes being called Uom, he told me. Thanks. Now that the Deputy Minister is here, I would like to just formally start the morning and welcome all of you, and welcome the Deputy Minister. You are welcome. The team is ready for you. But before I actually call upon the Deputy Minister to give her address, I just want to share with you what I learned yesterday. And I do believe that some of you have learned something else. I've learned that Vila Vila is the best place to be this week, and that all of you must come again and again. And those who said they wanted to go back to their different municipalities and provinces, you still have this afternoon and possibly even tomorrow to enjoy the place. There are quite a number of beautiful places to be. What we've also learned is that government has been on a long spree through the Innovation Conference to innovate. And through the CPSI, this has been happening for the last 20 years. And in those 20 years, the innovations that were showcased in the conference, many of them have had some impact, a great deal of impact, and they are just not here for prizes. They are here to change people's lives. What we also learned is that Africa is the birthplace of innovation. But there was some little bit of subtext that suggested that that innovation has nothing to do with witchcraft. And so I think that's an important thing. The other aspect that I've learned is that sovereignty is more than data being stored in South Africa. It also means the ability to engage with that data without having to rely on other nations. We also learned another thing. This is quite an interesting lesson that I think we have learned, is that innovation can be both good and bad. It can have bad consequences. It doesn't mean that when we do innovation, we are only going to get the good things. And therefore, because innovation can have bad consequences, as we innovate, we need to be more careful with our innovations. You know, thieves sometimes are very innovative as well. And therefore, the innovations we build need to be innovation for good. We also know that through the service standard, that the digital transformation of government has implications not only at the digital space, and also in the way in which we organize ourselves. There was an interesting comment that every digital government policy has to meet the steel, the machine, that we can have a policy, but if the infrastructure and the steel is not there, we may not be able to achieve that policy. The other lessons that I have learned is that innovation takes many forms. In some cases, it is mission-oriented. In other cases, it is anticipated innovations, and it is adaptive, and it can also be an enhancement of some of the processes. In that context, we also have learned that sometimes as we try to innovate, we will fail, and we must learn to deal with those failures of innovation. And until we then learn to deal with the failures and are in a position where we are not afraid of failure, it is only then that we will be able to engage with innovation. It is something we cannot avoid. If you are doing good, you still need to innovate. If you are not doing so well, without innovation, you will sink even faster into the mud. I would like to now, as I call upon the Deputy Minister to the podium, to just say that most of us as public servants, we are almost held rigid by policy. And our understanding is that policy doesn't, everything we do has to be in policy. The question that we then need to ask ourselves is that if it is not written and we don't want to do it, what can we do to get it written? How do you get the things that you want to do to be written in such a way that we can do? The Deputy Minister is somebody that I can tell you has been a public servant in the coal fields. She has been operating at the local level, she has operated at the provincial level, now at the national level. She is well placed to give her input about innovation in the public service as a game changer. Deputy Minister, the platform is yours.
Thank you very much, Program Director, Dr. Slapelo. Something that you did not declare upfront about yourself, that when you came back from exile, your dad was my second inspector in Bilabela. So we trained you here at Manpower as a former Seboshwa. So Bilabela is your second home as well. Program Director, let me take this opportunity to recognize the provincial government of Limpopo. I'm told yesterday the MEC of Finance, who is also a boy from the Waterberg, was here. MEC Kabo. We really want to appreciate the presence of the province, but also the councillor from the Bilabela municipality. As you know, this is crunch time. IEC wants compliance. So many provinces are busy with registration of who's the councillor, who's the mayor, and so on. And you can see we are under siege. So, yeah, that's why the mayor could not be part of us. Let me recognize the Acting Executive Director for the Center for Public Service Innovation, Mr. Pierre Skoenraad. Special recognition to the Chief Policy Analyst from the Office of the Prime Minister in Namibia, Mr. Austin Sikanda. I'm saying special because we have walked a long way with Namibia through the CPSI. But one of the things that I was saying to him is that in Namibia there's Varambat. And here we are in Varambat. In Namibia there's Waterberg. And here we are in the Waterberg. But not only that, during those days when of apartheid, we used to have askaris that were called Kufuts. They are in this town, just behind Palapala. So that's where the Kufuts are. We gave them a farm. But as you go to Lipalale, we have Hereros. The people of Samuel Maherero are also here. So there are quite a number of similarities between you and ourselves. And this time around, I was wearing the cape of being a daughter of the Waterberg. Yeah. Back to basics. Let me also recognize leaders and officials from all three spheres of government who are here, including entities. I've seen quite a number of entities that are also displaying their good work on innovation outside, our partners from business, from academia, from civil society. Ladies and gentlemen, good morning. I want to begin with a thought that may make us slightly uncomfortable. The opposite of innovation is not tradition. It is indifference. A government can possess the most sophisticated technology, the most beautiful buildings, and the most ambitious strategies. But if it becomes indifferent to the lived realities of its people, it has already stopped innovating. Actually, it may not even have started. Innovation, therefore, is not fundamentally about artificial intelligence, about digital platforms or automation, or the latest buzzwords. It is about refusing to accept that citizens must continue suffering simply because this is how we have always done things. That, to me, is the real meaning of this conference theme, Innovation, a Game Changer, because the game we're trying to change is not technology. It is the experience of being a citizen receiving public service from us as public servants. Yesterday, our Minister Inkosi Mzamo Buthelezi, of course through the acting DG, because Minister could not be with us here, reminded delegates that this conference over 20 years has become an important platform for exchanging knowledge, practical lessons, and innovative solutions across sectors. The Minister urges us to understand that knowledge on its own has never changed society. Knowledge becomes powerful only when it changes behavior. And behavior becomes transformational only when it improves the lives of the people. There is a beautiful passage by Khalil Gibran in the Prophet, which says, and I quote, "All age is blind, save when there is knowledge, and all knowledge is vain, save when there is work, and all work is empty, save when there is love," close quote. Those words capture the essence of public service because ours is not merely a profession, it is a calling. So, ladies and gentlemen, every public servant should occasionally ask one simple question: do I know the people I serve, or do I merely know the systems within which I work? There is a profound difference. A system sees statistics. A compassionate public servant sees people. A statistic tells us how many households lack access to water. A person remembers the elderly woman carrying buckets before sunrise. A statistic tells us about unemployment. A person sees the graduate who sends out 100 applications and receives silence in return. A statistics tells us that citizens spend hours waiting for services. A person understands the mother who loses an entire day's income standing in a queue outside a government office. That is why I have often said that distance is the opposite of empathy. The further government becomes from the daily realities of citizens, the more difficult it becomes to innovate meaningfully. As a former Deputy Minister of DCDT, I can tell you emphatically that citizen-focused innovation does not begin with technology. it begins with listening. Listening carefully enough to understand where the frustrations live. Listening honestly enough to admit where government is failing. And listening humbly enough to allow citizens themselves to become co-creators of solutions. Batupili was never intended to be a slogan used in speeches and displayed in walls. It was intended to become the physical conscience of the public service. People first, not processes first, not bureaucracy first. People first. This is particularly important as we navigate an increasingly digital future. Digital transformation presents extraordinary opportunities to improve access, efficiency, and responsiveness across government. But we must never confuse digitalization with inclusion. There remain many South Africans for whom online government services are not easily accessible because of affordability, because of connectivity, because of disability, literacy, or geographical isolation. And so, innovation that excludes is not innovation. It is simply another form of creating inequality in an already unequal society. Our responsibility is therefore to design public services that are technologically advanced while remain profoundly human, and that's where the public servant comes in. It's also where the public servant makes his or her role indispensable, because humanity can never be replaced by AI or by any future technology. So your job can be done by AI in the future, sure. But if you do your job with humanity for our people, you can never be replaced. Technology should reduce the distance between government and citizens, not create new barriers. It should shorten queues, not merely digitize them. It should restore dignity, not demand greater complexity from those already struggling. That is the standard against which innovation must be measured. So, ladies and gentlemen, innovation also requires courage, because meaningful innovation inevitably disrupts comfortable habits. It asks institutions to collaborate rather than compete. It asks managers to reward experimentation rather than punish every failure. It asks government to work across departmental boundaries, because citizens do not experience government in departments. They experience government as one state. A leaking water pipe, a dysfunctional clinic, and an unemployed young person do not belong to separate silos in real life. Neither should our solutions. This is why collaboration between the three spheres of government, together with partnerships involving academia, business, civil society, and communities, remains indispensable. No single institution possesses all the answers. But collectively, we possess remarkable knowledge, creativity, and experience. We must learn to combine them. I'm particularly encouraged by the participation of young people in this conference. Innovation has always belonged to those willing to ask difficult questions. Young people bring a daring curiosity that challenges assumptions many of us have unknowingly accepted. They are not simply beneficiaries of innovation. They are designers of the future. Our responsibility is to create public institutions where ideas are heard from all, where talents are nurtured and leadership, irrespective of age, race, or gender, is welcomed. As we continue commemorating Women's Month and reflecting on the 70th anniversary of the historic 1956 Women's March, we are reminded that courageous change has often been led by those whom society underestimated. The women who marched to the Union Building were innovators in the truest sense. They reimagined what was possible. They challenged the unjust system, not because change was guaranteed, but because silence was unacceptable. Their legacy calls upon us to confront another painful reality. So it would be remiss of me to not say that there can be no meaningful innovation in a society where women and girls continue living under shadow of gender-based violence and femicide. Our innovation agenda must therefore include the creation of safer communities, responsive institutions, and public services that protect dignity and fiercely as they pursue efficiency. Innovators, the future of South Africa will not be determined by brilliance of our policies alone. It will be determined by whether ordinary citizens experience a government that listens, that learns, and that acts. A government that understands that empathy is a governance competency, that collaboration is an institutional strength, that technology is a tool, not the destination, and that innovation ultimately finds its highest expression when it restores hope. Let this 20th Public Sector Innovation Conference, therefore, be remembered not merely for the ideas we exchanged, but for the courage we demonstrated in taking those ideas back into our institutions, because citizens do not live inside our strategies. They live inside the consequences of our decisions. May every innovation we pursue make government more accessible, more ethical, more responsive, and more human. And may we never become so comfortable with the way things are that we lose the imagination to build the South Africa our people deserve. Thank you.
Thank you very much. Can we do that again? Yes. Megakana Wadibusa, she keeps on, every time she speaks, I get spellbound. Ke bolela sekgowa se se ba rileng se remisha tlhogo. spellbound mina or ka re ba ntoile ka mokgwa ba bolelang ka gona. Okay. So that was great, and I think the critical thing is that it is about people. It is about people. So, ladies and gentlemen, let me then take this opportunity to then request and I think what we can do is even the panel can be can start moving towards the platform. Me Tando Nyembe from Betha Towa Hospital, Academic Hospital, and Me Jocelyn de Kock to be on the platform at this point. And then as Ms. Jocelyn de Kock is getting to the platform as she's speaking, then the rest of the panel, Dr. Ipelengu, Ms. Siburang Seku, Mr. Stembiso Mlangeni, Bandile Ndombela, and Khatliso can come, and Devante Mapari. They can come a bit later. So, let me check. You are Ms. Tando? Okay. And the team there has... Okay. It's a very nice name. Tlika. They call it a Tlika. It's a very practical name. Its job is to click. It's to click. And I don't know what you would call a finger which keeps on pressing on the phone. It's also a clicker, ne? Press. Metando, let's hear what you have to talk and share with us around the multi-people-centric innovation, the multidisciplinary healthcare delivery. The floor is yours.
Thank you, Chair. May I have my presentation projected, please? Good morning, honorable guests, conference organizers, colleagues, and my fellow innovators. My name is Tando Nyembe. As introduced, I'm the Assistant Director for Clinical Support and Therapeutic Services at Betha Towa Hospital. And as introduced on my bio on the program, it is a true reflection of who I am, even though I gave away my age. It's okay. It's quite overwhelming, but also a great honor to stand here and have to present after such, a powerhouse as our Deputy Minister. Thank you so much. So today I want to share with you a people-centric innovation that was born not in a boardroom, but in our hospital corridors. An innovation born from watching mothers carry their children across our hospital more than 5 times in 1 month, only to be told, come back next week for the next department. So our hospital, Betha Towa Hospital, was designated as one of the Center of Excellence for children with special needs in Gauteng province. And with that mandate, we then set out to reimagine the care for children with special needs. So beyond clinical outcomes, this project was also designed with a fiscal responsibility mandate, which is aimed at reducing litigating costs to the Department of Health by ensuring timely and quality medical and therapeutic interventions for children with special needs. We learned this a few years ago when Gauteng Department of Health won its first case to have a plaintiff use public services on a basis that we are as capable as our colleagues in private sector. So with this model, we are now taking a proactive steps to care for our children early, improve quality services, and demonstrate the strength in our system while saving the department costs in the long run. So the theme of this conference, innovation, a game changer, and that is exactly what our multidisciplinary healthcare delivery model was designed to deliver: people-centric innovation, not a new machine, not a new building, but a new way of delivering care, a multidisciplinary healthcare model that puts the child at the center. So, as I've already alluded, that the conference theme aligns with our innovation as a game changer in public service delivery, this model is also rooted in policy. The National Development Plan of 2030, which seeks to promote a growth for promoting inclusive socio-economic growth and universal access to dignified high-quality healthcare. The innovation is also aligned to Batipulu principles, which, with our innovation being a direct execution of access, quality care, courtesy, and absolute value for money. The innovation is also aligned to Department of Health strategic priorities aimed at actively reducing systematic fragmentation in chronic, pediatric, and special needs pathways. The innovation also puts our citizens at the center by ensuring that families, they are protected, they are empowered, and they never lost within our administrative processes. So as a center of excellence designated by Gauteng Department of Health Therapeutic Services Directorate, we were mandated to lead. But more than policy, this is about people. The citizen is no longer lost in our system. People-centric means we design services around the person and not the process. Therefore, policy gave us the mandate, and the children with special needs gave us the agency to implement these policies and strategies. Right. So before this model, our patients were paying the price for fragmentation in our care. Families navigated 4 to 8 departments on different dates a month, waiting 3 months or longer for their initial multidisciplinary appointment. So that created financial burden to caregivers, transport costs, lost wages, lost school days, and over and above, delayed therapy intervention for physical therapy, delay in getting assistive devices and nutritional care. As one of the parents once told us, by the time we finally managed to see everyone across departments, my child had already regressed severely. Therefore, the old model was not healthcare centered on people. It was healthcare centered on departments because we were working in silos and ineffective in our care as a result. So the innovation was the one-stop clinic model where all vital services were consolidated in one single visit a month. So we redesigned delivery. We flipped the model to be people-centric. Instead of 10 visits to 10 departments, we created one visit with 10 departments. So once a month, one place, one day, where our patients will come on appointment basis. They will triage first, then be seen by all relevant departments. Then we have a team case conferencing for one integrated care plan. We also added a dedicated pharmacy counter. As you know, this is one of the departments with more complaints on patient experience of care due to longer waiting times. So we also have parents empowerment sessions and support groups, and a data system to track the children and monitor the up and down referral system. So yes, this is what happens when you design for people first. found it. Okay, so people-centric care requires people working together. 10 disciplines in one center. So from pediatrics to our psychology, OT to audiology, social work to dietetic. The child is at the center of this wheel. We assess together, we plan together, we treat together. There's no more working in silos. This becomes a multidisciplinary delivery with a human face. So the impact on people is real. We have 58 children actively managed on our database. So since the inception of this program, we have managed to cut waiting times by 66% from 3 months to 1 month. Hospital visit by 80% from 5 visits to 1 a month. And families have saved money. Children return to school faster. Caregivers don't miss work often. We set out time for therapy, and caregivers feel supported as a result. So from a systems view, by providing timely, capable public service, we support the department's strategy to prevent litigation. And this proves that public health care can deliver when it's designed around people. So sustaining people-centric innovation takes more than goodwill. We have leadership protecting our clinic time. We have support from our CEO, our district leaders, cluster, and provincial leadership as well. We have built a unified team culture that values the person over the process by breaking silos through unified cross-functioning planning sessions. And the staff are motivated because they see human impact. We are data-driven, and we have dedicated space and formalized system workflow. We've partnered with crèches, schools, NGOs, universities, and peer educators to ensure that our children receive quality services suitable for their needs. And our key lesson here, what we've learned, is that innovation is 20% of an idea and 80% of the commitment of putting people first. So in terms of challenges, we work in a department with the most challenges. We all know Department of Health, Madlanga Commission and all. And yeah, it affects our operations severely and really tests our commitment to people as public servants. So for high service demands and increased workload, our mitigating strategies, we do staff rotations, and we ensure that we block the clinic time, and we do continuous training and development programs. So the challenge of space is mitigated by staggered times. We coordinate our services through annual and monthly planning and structuring our programs. So communication is done via WhatsApp groups, emails, and also creating rosters amongst our staff. So challenges with referral pathways, they are mitigated through our stakeholder engagement at district, at cluster, and provincial forums. So the biggest challenge in improving services for children with special needs is the budget constraints for assistive devices. Therefore, more advocacy is needed for allocation of a stable budget for assistive devices for children with special needs. So for every challenge and a solution, we ask ourselves, what is the best for the child and the family as well? So this model is scalable because it's about people, not the infrastructure. Therefore, any hospital and clinic can replicate this. Our short-term goal is to have bi-monthly clinics to get waiting times at least under 2 weeks. So obviously, this is highly dependent on staff complements. And our medium goal is to have all our children with special needs enrolled into the Central Chronic Medicine Dispensing and Distribution Program. And our long-term goal is the link to schools and community rehab. We are already there with our IS for mapping of services for children with special needs in Gauteng province. And then we will also advocate for devices and post. And our ultimate goal is to scale a delivery model that proves citizen-centered is possible in public health. So, honorable guests, I'm proud to share that our people-centric multidisciplinary model received a national recognition. We were awarded with the CPSI award in the category of citizen-focused non-ICT innovation, recognized for specifically pioneering our one-stop clinic model. Now, here's what is more, like what makes us even more prouder, that 100% of the prize money that we won was directed back to the therapy center. We didn't buy KFC or Nando's with the money that we won. We didn't put it into administration, we put it into the children. The purpose was very clear that we wanted to transform our center into a more vibrant, modern, child-friendly and healing landscape. So, because healing is not just about therapy, it's about the environment, and then this is where our team spirit showed as well, because the entire physical revamp was hands-on and executed fully by our dedicated therapists, including myself. No contractors, just therapists after hours. We're painting, building, designing, because when you believe in the work, you build it yourself. So this award was not just a trophy, it's a proof that innovation, when it's citizen-focused, gets noticed and it gets reinvested back into the people that we serve. So I've got just a 30-second video. I don't know if it's gonna play. This is how our gym looked like before. So yeah, thank you very much. So when all else fails, as in the department, we are just go, or AI takes our jobs, we are going to go and be interior designers. So in conclusion, colleagues, I just want to say people-centric innovation is not always technology. Sometimes it's the courage to reorganize around the human being. So our multidisciplinary healthcare delivery model proves three things: that access improves when you design for people, and teams deliver dignity when they work as one. And putting the child first is the ultimate game changer. Thank you very much.
Thank you. Can we do that again? I think yesterday I talked about luck in the sense that I think she is lucky because I had not looked at the timing quite strictly before she spoke. So if you look at your programs, you will realize that UMP's timings don't add up. So I have to actually readjust. He told me that I need to then be the whip here and manage the time. So the people who are going to speak now, because this session, this part was supposed to be 30 minutes, but from 9:30 to 10. And now we are at 10 and so on. So all of you start thinking how you can remanage whatever you have done. And what I will then do is if I think you miss by, so I'll give you, instead of 15, 10 minutes and so on. And if I think you will just hear my shade here next to you. Thanks, you can come. No, that's Miss Jocelyn there. I will.
All right. Good morning, everyone. I'm Jocelyn de Kock. I'm a chief physiotherapist at Charlotte Macleay Johannesburg Academic Hospital. And I'm going to be presenting on our project and our expansion of our clubfoot services. So, if we look at this is just a brief overview of our hospital. We're based in Parktown in Johannesburg, and being an academic hospital, we provide a wide range of services, including very specialized services, such as cardiothoracic surgery, oncology, orthopedic surgery, neurology, and neurosurgery. In our physiotherapy department, we cater to all the patients that are in our hospital and as well as outpatients. And that includes pediatrics, trauma, surgical, medical, orthopedics, neurology, and our outpatients. So a bit on the background of this project. So clubfoot is the most common congenital deformity in children. It can affect one leg or both legs, like you can see in that first picture, that's of both feet. And the impact, it can become a significant deformity if it's left untreated, and that's where you see on that second picture on the right-hand side, a foot that hasn't been treated effectively. It also results in a lot of stigma. In our clinic, we've had cases where children have been denied going to school because they can't wear regulation school shoes. Loss of income generation capacity, because obviously if you can't walk effectively, even though they do walk, the chance of you finding gainful employment is very highly reduced. And then the aesthetic component, like wearing shoes and just how the patient looks and how they feel because of this disability. So the management, depending on the type of clubfoot, either positional stretching program is usually sufficient for that. If it is a rigid clubfoot, like in those pictures in the previous slide, we follow the gold standard of the Ponseti method, which includes 2 phases: a casting phase, where they receive intensive casting over a weekly cast over a period of usually 6 to 8 weeks, and then a maintenance phase where they go into specialized boots, and that continues until they are 4 years old. Okay. So our clubfoot clinic, what it looks like, it runs every week. The staffing was 2 orthopedic surgeons, 3 registrars, and 1 physiotherapist. And then we get support from STEPS, which is a clubfoot advocacy NGO, and they also help facilitate. We buy some of our boots from them as well, and they help with education and just compliance with our patients. So our journey with our clubfoot clinic, initially it was just being run by our orthopedic surgeons, and then we found that the clubfoot services were very centralized. So patients were traveling very long distances, and this was having a big impact on compliance. So physiotherapy joined the clinic in 2019 after we started our training program, and 2 physiotherapists were trained during this time. And in 2019, we identified that we needed to, it's an opportunity to train physios and to also expand the services. So we wanted to increase the capacity in our clinic, and we wanted to set up satellite clinics to decentralize the services. So our first training in 2019, we only targeted physiotherapists that were working in the Gauteng Department of Health, and we trained 16 physios. We actually trained 2 occupational therapists as well, and you can see the facilities that we managed to train there were Chris Hani Baragwanath Academic Hospital, Dr. Yusuf Dadu Hospital, Tshwane District Hospital, Jubilee District Hospital, Hillbrow Clinic in the Joburg Health District, Tambo Memorial Hospital, Sipho King Hospital, and Charlotte Macleay. So the outcome of that training is that especially in our facility, physiotherapists then joined the Clubfoot Clinic and boosted the staffing in that clinic. And then 4 satellite clinics started at Tambo Memorial Hospital, Sebokeng Hospital, Jubilee District Hospital, and Dr. Yusuf Dadoo Hospital. So our training journey has continued. We had to take a break during COVID and after the fire incident at our hospital. But in 2022, we resumed again, and then we expanded it to train other healthcare professionals as well. So we looked at physiotherapists, occupational therapists, podiatrists, and orthotists. And in 2022, we trained 21 people. In 2023, it was the same target group. We managed to train 29. In 2024, same target group, and we trained 36. And in 2025, the same target group, and we trained 18. So the total number of healthcare professionals that we've trained to date is 120. And we have those same 4 satellite clinics, and we've managed to add an additional 2 at Leratong Hospital and Rahima Musa Mother and Child Hospital. We've also managed to carry out support visits to Dr. Yusuf Dadoo and Sebokeng Hospital, and other support visits are to follow. So, like I said, our training has been extended to cover more professionals, and in some of the trainings, they even asked if they could bring some of their doctors, so we have managed to train some doctors as well. And the physiotherapist involvement in the Clubfoot Clinic at Simja is that it's not only in the casting, which we do assist with, but it's also in identifying children who need therapeutic intervention and facilitating those therapeutic appointments. So currently our training is continuing, and we're in the planning stages for research outputs about our project. I think just a note that I wanted to make in terms of the innovation. I think often we think innovation is like this big scary thing and you have to have a big fancy plan to achieve innovation. But often it's just addressing a need that you have in your workplace and trying to make a workaround and in our case, do the best for the patients and the people of the country. Thank you.
Yeah, thank you. You did steal 2 minutes of my time, but that's fine. It's for a good cause. Can I then ask Dr. Ipeleng? You also still have 10 minutes or less.
Thank you so much. Thank you so much, DDG. Good morning to you, and good morning, ladies and gentlemen. How are we today? Good, that's good. You know what, I know DDG has taken a little bit of my time, but it would not be doing this seating any justice if I didn't say to all the women in the house, Happy Women's Month. Just a round of applause to you. Happy Women's Month. So DDG, let's not take note of that time. Can I please just have the presentation flighted? Thank you so much. So, colleagues, as mentioned, my name is Dr. Ipeleng Nku. I'm currently the acting CEO at Edenvale Regional Hospital in the city of Joburg in Gauteng. And I'm so pleased and honored to be here today. And with that, I just want to pay some acknowledgements. Acknowledge Deputy Minister, Ms. Pinky Sharon Gegana, as well as all the senior leadership that has joined us today. Mr. Piers Kroonhardt, I'd like to acknowledge you, and to acknowledge everyone today that's here today to listen to the presentations. Oh yes, let's just move on. So colleagues, today what I will be talking about is how we enable a culture of innovation from the point of leadership. Because we need to understand that the innovation and the talent is actually on the ground. It's with the people that are actually working. But if management is not supportive, there's bureaucratic systems and there is barriers. It always starts at management. So we need to make sure that we can, from problem identification all the way through the process. And my 2 previous speakers that just spoke, we heard how management has to be a part of it. Because if management is not a part of it, innovation will not work. And to just move through my story, I will be going and telling you a little story, a very short story of innovation, just like the previous 2 speakers. So I come from a hospital, Edenvale Regional Hospital. We serve a population of over 1 million people. And over and above it, it's actually a catchment population. People that are outside of the catchment come in. So we see very high service demand and we see a high number of patients. Although our hospital is a regional hospital, it's only 230 beds. So it means on average, just for the previous quarter that we came out of, I'm sitting at a bed utilization rate of 120%. It means at any given time, we are at about 120%. Where does that mean patients are? We have to make plans, extra beds, things that we are not necessarily funded for. So that is just where we are sitting from a point of the challenges that we are facing. And the story actually is about our pharmacy. So initially our pharmacy was servicing patients from 8 o'clock in the morning till 4 o'clock. So due to the high demand of services, our patients were actually sitting at an average of 77 minutes, and this is in the pharmacy, after waiting for a file, after waiting for a doctor, after waiting for physiotherapy services, the whole MDT team. Then at the end, just when you think, oh, I'm going home, then you have to wait 77 minutes in pharmacy. So this caused patients to abandon the medication. It caused patients to actually miss their appointments. And it caused a lot of frustration, not just with the patients, but also with the staff themselves. So what the pharmacy decided to do, and they did this all on their own accord, is to interview and do a study in the pharmacy to hear the patient's perspective. Deputy Minister, you mentioned it in your speech. You said, how do we empathize? Put yourself in the shoes of the person, of that mother that Deputy Minister spoke of. She said there's a mother with a child in a long queue in a government institution. So that's what we did. We went in and we interviewed the patients to hear their perspective, because sometimes we think you know what the answer is, but the answers actually come from the people. Initially, after looking at the interview, they looked at a digital queuing system. When they came to management, I think it cost about 300,000-400,000, which unfortunately we didn't have. So what management did was encourage them to say, let's look at what we have, and let's try to use what we have as efficiently as possible. And with that, we looked further into things. We used the fishbone diagram and looked at the contributing factors, which is the root cause analysis. I'm just going to move through some of these slides. And what we also did is started looking at potential solutions. I know yesterday in one of the talks, we were talking about prototypes. This is where you start looking at what can be done, what are the solutions. And we looked at quite a few things. What did we use? Another methodology called lean management. It's a 5S principle, where what you're trying to do is maximize the value within your value chain, but at the same time, remove all the waste and minimize all of the waste. And this is just a little bit more on the potential solutions from looking at it from a lean management perspective, where you're looking at dedicated shelves for specific orders, pre-packing medication, re-engineering the whole process flow that we had within the pharmacy. And one of the main things that was done, sometimes you think and you say, oh, what did you do? You just moved around your dispensing system. This was a very important part of it, and that's why it is on a slide on its own, where different windows were dedicated for different patients, because we had elderly patients, pregnant patients that were waiting in the same queue as everybody else. And you have to look at prioritizing, correct? There we go. So, colleagues, I'm pleased to announce that after implementation of what we called the speedy queue, because it's a queue and it's quite speedy, so the speedy queue system, that is what it's called. These were the results. I want you to pay close attention to these graphs. What is in red was the previous year before we started. This was the waiting times per month. And what's in green was the waiting times in the pharmacy after implementation and after just changing around the value chain. So through this, what we actually ended up getting was reduction of waiting times in the pharmacy in a regional hospital by 78%. And yes, let's give it a round of applause, please. And might I just say, I just think what's very important here, and this is where I want to emphasize, is that we didn't get a digital system. We didn't have add any more money. We just re-engineered the system. We looked at removing waste and maximizing the value that was already there. And through that, we reduced waiting times without a single cent. The only thing was a little bit of the overtime was done for pre-packaging. So colleagues, that's what innovation can do. Innovation doesn't require money, and I know we keep hearing it from different speakers, but these must be the takeaways from us. So the impact of our Speedy Q, going to run through this very quickly, but it was obviously shorter waiting times. We had less reduction in complaints. We had increase in compliments. We had staff that was used to be demoralized that now was more inspired. We had decongestion of the pharmacy, and we had improved service delivery. Don't know if we noticed, as I was going through the slides through my short story of innovation, there were things that were in red. Those things were just highlighting the areas of the design thinking process. It's very interesting how you do the design thinking process and you might not even know it's an actual methodology. I was hearing it through my previous speakers that they were going through that process where you empathize and you then move, I'm just going to move on, where you empathize, you define your problem, then you ideate it to see what can be the possible solutions then, and then you get a prototype that you then move on to it and test it, and then you fully implement. So colleagues, this is the design thinking process, and that is how it was done through the short story that I just told about the Edenvale Pharmacy. What's very important, and my job here today, is to say what was the leadership role in that whole process? Because we heard the story, we see it's a design thinking process, we see it's about lean management. Where was management? Where was leadership in this? So what leadership did in terms of empathizing is allowing an autonomy. You have to allow autonomy. And autonomy also speaks to Mr. Van der Walt. There's Mr. Van der Walt in the audience that's already asked a question. He's already asked a question. Mr. Van der Walt, can I please see you so maybe I can just address you as I'm going? Thank you. You know, speaking about how do we make sure that we don't concentrate innovation at senior leadership. Rather, it must be taken by the people on the ground. And this is what's very important. Part of it is autonomy. There's another slide that will speak to it. But we need to realize that you have to give the people on the ground a chance to speak, a chance to see what they can do, and allow them to do that. You need to provide direction and guidance. I'm going to just move on. So allowing autonomy, what was done was, the study was done independent, completely independent of management. Flexible working hours were instituted. Now, sometimes this gets frowned upon because there's one department that says, oh no, marabale, no, why are they leaving earlier? It's because they came in an hour earlier. Because we noticed that there are some doctors that come early and patients are waiting for the pharmacy to open at 8, at about 7:30. Why not start with those patients already? So you can then start working on a pull mechanism instead of being pushed by the numbers that are coming in. So that's what was happening. We had flexible working hours. If management is too constrained and too bureaucratic, you say no to that. And then the system like this will not work. We had pre-packaging of medication, which also, as I mentioned earlier, is about overtime. A little bit of overtime was there. And then familiarizing yourself with the challenges. Very important. Management cannot be contained in our offices. So at Edenvale Hospital, what we do is Gamba walks. We do Gamba walkabouts, where we go and we see. This is where you can see what's actually happening. You see that we are actually congested. Patients are in the pharmacy past 4 o'clock, where you want that pharmacy to start closing up. So we conduct our Gamba walks and weekly reviews. On a weekly basis, we review all the waiting times in all of the areas, as well as all of the complaints versus compliments in the institution. You have to provide direction and guidance, and how we did that is encouragement of all of the methodologies that I was just speaking to, and daily duty allocations. This was done in collaboration with the clinical manager, and then facilitating the process, encouraging lean management principles, and getting an open and safe environment that you can create within the institution. Continuation of that is providing resources. Very important. You have to provide the resources. Sometimes resources aren't necessarily money. Oh, DDG, are you ready? Your shadow's ready here. Here, okay, I'm in a little bit of trouble, DDG, okay. So, providing resources, and then, commending and celebrating. A lot of celebration was done around Speedy Q, and we managed to provide support and ensure that it's sustainable. You have to have continuous support so that you can sustain it. Today, I'm happy to announce that our waiting times are actually at 10 minutes. And they can actually average between 5 and 10 minutes. On most days, we had about 8 minutes, so I'm very happy to say that. And all of our priority queues do not wait. And let me see, I think that there is a slide. What does an innovative culture actually look like? This is very important, and it speaks to also the question that we got. It's where people feel safe to speak and ask questions, where ideas are welcomed and they are not dismissed, where frontline staff are empowered to actually solve problems. Teams must collaborate across professional boundaries, and learning is valued more than blame. I think you've heard a lot about not blaming. We need to learn, and if there is failure, we need to learn from it. And good ideas are recognized and tested. Some barriers to innovation, I think some speakers have touched on this. We need to be very important for management to be cognizant of the barriers that exist within the institutions that stop innovation. So, we have always done it this way. No, it's still working. We will never move forward. We wouldn't have electricity, we wouldn't have this big venue if we always just said everything is working as it is. Fear of criticism, hierarchy, and bureaucracy that I've spoken to, and leaders who unintentionally shut down ideas. We shut down ideas sometimes without realizing it. When someone comes in and says, here's an idea, you know that taking 3 months to try implement it is already, it's shut it down without you realizing that you've shut it down. Answering without actually listening properly. You're shutting down ideas, not giving them that platform. So we need to be very careful about some of these barriers. The role of leadership is to counter those barriers. I'm done, DDG. Let me just see. I had 30 minutes initially, so I'd prepared a 30-minute presentation, colleagues. I think let me just close up as DDG is waiting. As I'm closing, I'd just like to say, please be aware that, leadership actually creates the possibility and the opportunity. And what that does is that you have to empower your people to then create the innovation. And with that, innovation then creates the positive change. So please just keep this in mind. And as I close, I'd just like to leave you with the quote that does say, visionary leadership is not about predicting the future. It is actually about creating the future that we want to see. Thank you.
Thank you, Dr. Ipele. I'm doing what they call lean management of time. But you remind me of the pressure I always have where people decide to send me voice note instead of text. And then I have to press double speed so that I can jump through the other things. But don't stress too much. As we get the time, you will have the time to then re-emphasize some of the points again. But let me then, you are one of the few people who calls me DDG. I don't like that. It's a passing phase in my life. Bandile. Is Bandile here? Tate Bandile. Okay. People call me Martin and it's fine. It's your chance. Okay, you can speak because I think Okay, let me ask those who have already spoken, who will not be in the panel, to then give us a little bit of space. Apparently, I must also manage lean space management. Okay. Yeah. Those who are in the panel, you can remain. That's fine.
Thank you. Good morning, everyone. Ndimacheloni, Tovela, Abusheni, Khuyemore. Yesterday someone said when you are in Limpopo, you must speak all these languages. So I'm from Limpopo myself. I am Devante Mapari. I'm from Gauteng Department of eGov. I also studied at TEFLOP, not at University of Limpopo. So I studied at TEFLOP, and it remains to be TEFLOP for me. not Kupa presentation. I was given less than 15 minutes, which I'm just going to run quickly. I think 10 minutes. Okay. Thank you once again to everyone. I'm from Gauteng Department of eGov, which is one of the departments that drives innovation, technological innovation in the province. The focus of the presentation is mainly about citizen-focused innovation and how are we harnessing technology in terms of improving that innovation. It doesn't want, I suppose. Okay. Like it said, I have 10 minutes. There will be some slides that I will not necessarily speak to, but I will just run through them so that you can understand where is this coming from. We are in Joburg, CBD. We run with 5 pillars, which obviously are IT-related pillars. We have our MSc Bonginkosi Tlamini with the HOD Masabata. Our strategy of 5 pillars focuses strictly on technology, but we are harnessing this technology to help the business units, of which we do focus onto our infrastructure. I will speak a bit about that. We do focus onto our e-services. There is oversight committees that runs our governance. We advocate a lot of our services. That's why we even have a standard side. One thing that we know we have as one of the issue, obviously, it's skills. Skills not only to the officials, also to the SMME in the area, the youth in the area. We do a lot of that. We developed our 4IR strategy, say, 4 or 5 years ago, and of which in it there were 6 quick wins. And I can tell you that these 6 quick wins are still relevant, and we are implementing them. And what makes them still to be relevant? In our 2026 opening by the Premier, we identified about 13 problems of the province, which was relating to water, crime, lawlessness, cable theft, non-functional of our traffic lights, potholes, informal settlements, electricity, in terms of outage, load reduction, load shedding, drug abuse, gender-based violences, services in the hospital and clinics. My colleagues here, yes, speaking of Speedy Queue, we have started the deployment of a queue management system in the hospitals, and I can also tell you that we are gunning towards 1 patient, 1 file in the province. And also the failing of the infrastructure in the CBD, lack of schools. You've heard a lot from our MECs speaks about schools, and we also have a lot of problem on the basis of unemployment. So we do have opportunities, but are they there for everyone? What we did in analyzing our problems, we called for a hackathon. In the province, we ran it in all our 5 regions, which we had more than 383 participants, of which there was 1 winner. And we can confirm that in that 1 winner, what we did was we took 10 per region to the final. And their ideas were definitely to address the 13 problems. And those 13 problems, there was one winner from the region, and the winner was from City of Joburg. And then what we did, because one of our problem is about employment. We therefore employed all of them, the 50 of them. This is to demonstrate that we are addressing our problems. The Premier spoke about AI office, where we said, what is AI office? To us, AI office is seen not as a technical office, but an office that is a strategic partner of the province. We have then adopted a model that we ought to develop a strategy and a roadmap, understand the business case that we can take in terms of demonstrating the possibilities, the governance, therefore, of managing the AI activities that we do. Because as we know, that we upload a lot of data into these AI and they read our data. Today you can send a question to AI of GPG, say maybe procurement plan. It will give you. Why? Because people are uploading, not necessarily understanding what is happening. We have a technical assurance where we look into cyber security in line with that. Obviously, change management, just to make sure that everyone that is going to be impacted about it is therefore understanding where we're going. And obviously, these things need to be monitored. There's always a saying that we need management to be part of this. Our MEC of COGTA therefore formed work streams every day, Monday to Friday, 7 o'clock in the evening. Each and every work stream sit to respond in terms of addressing the 13 problems. I can tell you in that meeting, the Premier does sit from time to time. All the MECs in line with the stream they belong to sit. All the mayors that sits, they're there every day. So from our stream, which is a digital transformation, we are leading in terms of making sure even the municipalities are part of that. We are driving transformation of that with the municipality. And we report with our stream, we report every Thursday. Last night, it wasn't our week, it was governance week, but we report in terms of the progress, and of which I can tell you that through these streams, these are the projects that we have initiated, and these projects are running very well. I will just pick some of the projects that before one came here, the Minister of Electricity spoke of some. Even here in the conference, everyone is speaking of some, and of which we have those projects and we are rolling them. What we have done as a province, we have a provincial network. This is just a demonstration of where our network is. There was a saying that says, yes, you are implementing technology, but what is the benefit? This slide demonstrates that we as a province, last year, April, we were spending around 9 terabytes. But I can tell you now, as a province, in terms of our public Wi-Fi, we are sitting at more than 400 terabytes. Simply because we have integrated with municipalities, and then this is a free Wi-Fi that we are giving to the citizen. We speak about electronic recruitment. We have an electronic recruitment since April to date. We have advertised already 722 posts. In those 722 posts, we have received more than 439 applications. If you are speaking of 17,000 manual application, we do get 200,000 applications. And you'll find it's just one driver you find it's just 5 cleaners. So we do have that. So what we therefore modeled, obviously, is to understand where are these people coming from in terms of the wards, in terms of if we want people living with disability, how do we go about the race and the likes. So these are reports that as management we use sitting with the Premier to analyze them. Which direction are we taking? This is the project that we are now proud of. It's an electronic indigent. As a province, we don't issue indigent allowance, but municipality does. So we have, as a province, developed our own indigent register. It integrates with SASSA, integrates with deeds, UIF, the municipality, solar systems, Moonsoft, Home Affairs, Credit Bureau, meaning the indigents in Gauteng are known through the system. When you have applied for indigent, the system automatically analyzes you and qualify you, disqualify you accordingly. This is just the screen that demonstrates where we are harnessing the technology to extract a report in terms of giving the executive the decision towards knowing where are we going with it. So it's we also have a very nice tool in terms of managing the safety. If you have seen, one of the problems is about safety. We have, as a province, have an e-panic solution where you press the e-panic either for security services or for ambulance services. Our average was 55 minutes when through the system in terms of ambulances. Our average is, in terms of security services, is 14 minutes. This is over a year. But if we are to analyze on the daily basis per transaction, you will realize that we are now able to tell where in the province are we getting more panics and what types of panics are we getting. We have partnered with municipalities, we have partnered with private sector as well. But all in all, one here is stressing that alone we are not able to move. Every screen that I'm showing is demonstrating that we are working with someone. We have leaderships that are also involved with ourselves. Gauteng we've been having a lot of cry in terms of water management. We are able to tell where is the leak and how much revenue are we bringing into the province per municipality. And this is the technology that we have developed. We are working with CSIR in terms of Internet of Things devices, where we are able to tell immediate a story about all these problems that we have. Like I said, I just picked some of the project. Our stand is also here, we here, and the theme to us obviously is to change the game. As Gauteng, for us is also to partner with you, to work with you, to improve our lives, because I don't want to move from Gauteng, Govenda, and stuck because of something that I have implemented. I'm here to also work with you. Thank you very much.
Sure. Thank you very much. I do believe, Renee, I was listening to the Statistician General the other time talking about the mid-year population estimates. And they were talking about migration from provinces. And this is one of the biggest risks of doing well, because all of South Africa will then be moving to Gauteng to get all these benefits that they have just provided. So you need to make an effort to make sure that these innovations are spread throughout all the different provinces, so that there is a job for you in Polokwane or in Thohoyandou to do those things. Let's hear Free State. Thanks. Everybody has finished talking. Unless, if you are not presenting, that's fine. I'll give you a few minutes. right? Because they had said everybody will give us a little bit of time, but what I will do, I will give Home Affairs. Meseku, you have a presentation? That's great. My time is fine. I'm now very happy. The panel discussion will end at around 1:15, the discussion itself. And then at that point, at 1:15, Ms. Hamilton will do a wraparound for that discussion. And maybe what I will do, I will ask the Meseku to just give a just brief introduction of the issues that Home Affairs would like to talk to us about it, maybe about 3 minutes or so. And then I'll give you the mic there, and it will be followed by Ndate Mlangeni about that. And then I will ask 1 or 2 questions to some of the things. What I'm interested, you can start preparing the answer to question of which public service regulations you were able to manipulate to appoint people who won the hackathon.
Thank you, Program Director, and I would like to recognize the Deputy Minister. My name is Grace Wagasiku. Originally, my family is from Mokopane. I'm the Acting Chief Director, ICT, Portfolio Management at the Department of Home Affairs. So briefly, I will talk about what have we used innovation to improve service delivery. And particularly, I will refer to what we did with the e-Home Affairs, because that is technology enabled and is part of the digital transformation. So when we saw that we have a population of 63.5 million that the department needs to service, we looked at technology solutions so that those who are able to apply online. Majority of the process is what you do online. You apply, you populate all your bio details, you capture your details, you are able to pay, you're even able to book a slot so that you're serviced in the office or at the bank. And with that, it assisted us because we had challenges in terms of long queues, we had challenges in terms of infrastructure, that is physical infrastructure, but also issues of fraud and issues of just inhumanity in how we deal with people if we don't introduce technology. So I'll stop there for now. Thanks.
Okay, yeah, Bandit.
Oh, great. Good morning. My name is Bandi Lentombela. I work for the Free State Department of Health. I'm the director there for Information and Communication Technology. Chairperson, in the Free State, we have quite a big appetite for risk. We innovate quite a lot. But I think for the purpose of our discussion this morning, I will focus in particularly on the work that we have been doing across multiple spheres of government, the National Department of Health, Home Affairs, the province, as well as localized healthcare. I think all of us here, in one form or the other, have had an experience with public health. We know how excruciatingly frustrating it is to go to a public clinic, a public hospital, or any of the public health facilities, really. And I think Doc, in her presentation earlier, captured that quite well. So to resolve the chronic challenge of my patient record is missing, we are spending too much time in admission, we are spending too much time in pharmacy, we are spending too much time, where we do receive specialized health care, we don't even know how to pay for that service. So the National Department of Health, as well as the CSIR, then developed this system that is used in the primary healthcare setting, in clinics, that is called the Electronic Medical Record for Primary Healthcare, the PHC. The system was developed and co-created with our nurses and various other clinical categories in one of our health districts in the Free State called Dihlabeng. And then with the EMR, we are able to reduce the burden of using papers in our healthcare facilities. So there is no longer you're given a clinic card and you come that day, you have to spend 2 hours waiting for your card, for your file to be pulled from the registry at the back. Your information is available ubiquitously across all of the health facilities in the Free State. And for us, the innovation beyond what National and CSR have done is that the the implementation of a system of that nature, and the colleagues that work in the space will appreciate how expensive and laborious it is that we are deploying using a combination of multidisciplinary teams, the nurses themselves, people that are experts in data management, as well as the doctors. So for us, it shows that the state is able to create its own intellectual property and harness it and deliver value to citizens without overburdening, license costs and paying a lot of money to vendors, and only to still have the problems that persist in primary healthcare today. So we're quite excited about the EMR. We are now at 92 clinics of the 221 that are in the Free State, and we're targeting the next 4 months we'll have full coverage of the EMR. The results so far are quite positive. There's already around 500 encounters that have been logged online. We're getting feedback from patients on how it has improved their interface and interactions with the healthcare in the Free State. I think I'll keep it to that, Chair. Thank you.
Okay. For those who need to know, ubiquitous just means everywhere or at all times. Okay, Mr. Mlange. Ke batho ba IT ba ka mokgono, ska la ba makalela.
No, thanks. Thank you, Chair. My name is Chemiso Mlangeni. I'm from the Office of the Premier. I'm the Director of IT there. I just want to share a little bit on how we have modernized the business processes that relates to HR within the office and also the province at large. And I think the part that I just want to share, I think just like our colleague from Free State, I think the issue that we have been basically battling with in the main was basically the issue of dealing with the large amount of files and also the issues of dealing with applications that were coming, that were manual, and where you find that the majority of the work that needs to be done there, you have to find overtime, for the employees to do certain things. So like, when we started to automate the recruitment process itself, it basically assisted us, for instance, as a province, where we then started to have reduced, in fact, over time. I think we actually eliminated it in a sense, in terms of having a lot of HR practitioners dealing with capturing of those applications and so on, so that they prepare, for those recruitment processes. And then also, if you also look at the other parts that relates to the work that the HR also needs to do when it goes to screening and all those things. So we have actually used technology very effectively. And one of the things that we are also priding ourselves is that we are utilizing internal resources for us to be able to develop these solutions. We didn't rely on outside service providers, though we do partner with them, and obviously some of the resources that we get from CETA and so on. But in the main, it is the effort that basically comes from the developers that are within the province, and basically that has actually served us a lot of course. We have also noticed as well that since we have started with the process itself, it has actually made our province to have quite a lot of interest, or in fact to get a lot of applications that are actually coming from outside the province itself. I mean, in the past we were dealing with hundreds in terms of the number of the applications. So now, like in 1 month, I'm just looking at last month only, we got about over 1.2 million applications that basically came through our system. And because now we've got an automated process that is actually assisting us to deal with those things, so we are able to achieve those results in a few minutes. We also automated also the leave management process as well. And one of the challenges that I think most provinces and most people, a province like ours, will always have a challenge that relates to the fact that people that are in districts, sometimes when they bring in leaves, it takes it takes time, and sometimes the leaves comes after people have already gone on leave. So automating that particular process has actually assisted us to ensure that by the press of the button, and then those leaves are able to come to the central office, including the PMDS as well. That's also another thing that we have actually done as well as a province. One of the things that I also like about the part of innovation, it has actually said to us that the way you do things slightly changed. We no longer now knock off at 4:30, because in the past, all those PMDS instruments have to come at 4:30. Now, they can basically be dealt with using the system even after that particular period, and people can actually submit as long as it is within the time frame that has been stipulated, and it has actually basically assisted us to improve the way we do things. Thanks, John.
Dr. Ipeleng, when you did the presentation there and I was checking there, I saw Gemba. Gimba? And I was thinking Gimba in a different way, right? And in a different way. So just tell us a little bit more about this Gimba, and you can add up the other aspects that you felt I stole your time for.
Thank you so much, Program Director. So it's not Gimba, it's Gamba. Gamba walks. So I actually don't know, to be honest, where it comes from, where the word comes from, but it's across all health institutions, more so in Gauteng, where you conduct the walks in the hospital as the executive or senior management. So you actually go into the units, you speak to the staff, you speak to the patients, and we're seeing what's happening it's being on the ground. So there's a lot of on the ground initiatives that we do because we don't want to be leading from our offices, and so there's a lot of on the ground initiatives. One of them is actually called On the Ground with CEO, or On the Ground with EXCO, where you go on a walk, and it's a walk to see exactly what is happening in the institutions. So that's what the Gamba walks are. And just in terms of the things I didn't touch on, I think I managed to, as I was speaking about our SPDQ system, I did manage to touch on the main areas about how it's the importance of leadership, being the one that leads innovation. And just as, know there's some questions, but also just a follow on that I was going to touch on is where SPDQ is sitting and how are we also using our SPDQ system in other areas of the hospital. So we are doing that, not very easy. But it's because when you're looking at the dispensing system, it's very different from our OPD structure. But what we are currently busy with is moving that system into our OPD administration where files are opened. We've been trying to automate, as ICT has been speaking to, but that's obviously not so easy from a fiscal constraints perspective. And we are hoping that we'll be moving into that. In the meantime, we are just looking at implementing or benchmarking our SPDQ into our admin area. And then just another 2 innovations that I just wanted to touch on very quickly that were benchmarked also from other institutions. I think it's important that we benchmark from each other, you know. I can see a lot of the comments are also speaking to that, because one area of excellence, why does it not mean that other hospitals or other institutions can just do it and then we just become better departments overall? But there's 2 other areas. One was called the Saving Blood Initiative, and this one is also a very easy one. All we instituted, and it's through CPSI, thankful for that, was a blood accountability form. Doctors would order bloods, not use the bloods, but once we instituted the blood accountability form, we actually saw a decrease in the expenditure for our SANBIS, our national blood issuing. And then another final one that we're currently busy with is the Breslow tape. The Breslow tape is a pediatric tape where you measure a child's height, and on the tape where the child is, it gives you all of the information that you need for emergency treatment of that child. And what you do is you have different boxes. And this is all such simple things that can be done anywhere. You have a box with all of the emergency equipment that's required for that age, for that child, and immediately can be pulled out. Just by measuring the height, you have the weight and everything, and also the forms of the blood, the medication, and how much you give, as well as all of the equipment that you need for that particular child. So these are very easy innovations that I think are very practical, especially for healthcare institutions, that I think we need to benchmark with each other.
I do like this project that is not IT related. and especially because you can deal with the issues. It tells us about how innovation can be. And I think she has mentioned something, and I think some of the questions Hamilton will deal with them, but I would also like the other panelists to just look, but I will just highlight those that are quite agreeable. Please tell us the question I asked you about, is it because you are brave enough and are not afraid of the auditor?
Thank you. The 50 youth we employed are not necessarily employed by government. We did hackathon with our partners. Obviously, I don't have to advertise them, but we have employed them using the partner the partner arrangement, and of which obviously at the beginning it was very clear where the hackathon is taking us to. But while I move forward to other things that I did not speak to, that I think it was a slide around our projects. We decided to go against Treasury in terms of what we call e-procurement. So as a province, we are busy with e-procurement. We have already deployed it in 2 municipalities, which is Midvaal, City of Joburg. We are busy with our own treasury, working with Gautrain. We also have, you have seen a lot of land invasion around us. We have a solution, a satellite solution. Currently, we are taking snapshot of every 14 days, of which we are gunning to a day-to-day snapshot, where in terms of land invasion, we will be able to deal with. We obviously do have our employee self-services, where he speaks about PMDS, we speak about pay slips, all those services of HR are all automated, so we don't print pay slip, you don't have to go there. And
This
one
sounds like an advert for the department.
So one thing that I know we are all wasting is on subscription to the books in the libraries, where you find everyone subscribed to Judah. So what we then did is, let's have one province subscription where we busy with the e-library at City of Joburg, where whenever you want a book through that subscription, you can.
I want you to answer other questions,
Okay.
right? And I want you to deal with 2 questions in particular.
Yeah.
One relates to SITA, they say, ugarli dirle SITA, as
Yeah,
eGov.
yeah.
And the other one is that your public Wi-Fi, is it supported in-house or is it outsourced?
Okay. CETA has what we call a must service and a may service. So in terms of the may service, we are doing them, all of them as a province. So that's why we are able to move a bit faster with those services. And and I think what is also working for us in the province is that all departments reports in terms of IT, they reports to eGov in terms of the ICT procurement and all the activities. As a province, we have one master agreement with CETA. Therefore, meaning eGov is the one that speak to CETA, is the one that manages the relationship of the province with CETA. So as every other department having challenges with CETA, we also do have. The must service includes our public Wi-Fi. We have gone through CETA, so we are working with the third party with CETA. But however, the current strategy we are taking as a province is to do our own network. because I can tell you just that I did not bring the numbers that, that we have moved from how much we're spending with SITA and Telkom on the network with how much we are receiving now. We run a more than 100 gig line per site, not what we are getting from SITA, and it costs next to nothing. If I am sitting at sports calling someone at agriculture, it's an internal call, it's a free call. So that's how far we have gone with our voice over IP. And that is just simple agreement of working together internally. Thank you.
Okay, I'm going to ask you for 1 minute each. It's your last call to say something. 1 minute each. What in the way? Okay, all right. But in the meantime, start thinking your thoughts. What is it in how your department or your organization is organized that has made all the innovations possible? And what do you think, in 1 minute, right? And what do you think should happen in future to continue there?
Thank you very much, Dr. Martin Sitlapel, Doctor. I think I want to really commend this conference and how amongst yourselves as public service across the three spheres are sharing codes of good practice. There's one thorn on my flesh, and I'm sorry I'm giving you my back. There's one thorn on my flesh, especially in the health sector, and I think CPSI, learning lessons from what the hospitals are doing in Gauteng. Let's go to Eastern Cape. Let's go to Doranginza Hospital. I was in the DPME, because if you look at medical legal claim, the Eastern Cape is very high. Now, Doranginza Hospital has a unique situation. It is an emergency hospital for kids, for mothers who are pregnant, who must do cesarean section. So if they are saying you are emergency, it means you must arrive and be operated. But in Doranginza, you arrive, you wait for 3-4 months, and you are emergency. So there's a lot of cerebral palsy kids that are born in that area. And that's what escalates the medical legal negligence and so on. Can we go there as a delegation and look at that and see how we can help the province as one of the things? My last issue, if the e-indigent is working so well in Gauteng, and they're able to pick up Martin, that if Martin applies that he's indigent, they go to eNatis, they go to SARS, they're able to pick up he's not indigent. Why don't we help NSFAS? Because if a child is born and is a grant recipient, by the time that child finishes grade 12, NSFAS must expect that child and not make the child to apply again. So you capture the child as an indigent at grade 1, and NSFAS then plans. By the time she comes there, they are already, so this thing of glitches, hey, kids are waiting here, what, it makes us appear somehow. So, and e-panic. If you say you shall have achieved with e-panic, when a woman drives in Gauteng, that Mrs. who talks on the phone must say, now you are entering a serial killer area. Now you are entering. So make it to be smart to talk to us so that we avoid those things.
Thank you, Deputy Minister. But now you no longer have 1 minute. You have 10 seconds. All right, 15 seconds. Then I will cut yours. You will have 5 or less. Thanks.
Thank you so much, Program Director. So just a quick one. I think what we do in the hospital is I spoke to autonomy, allowing the people to actually come forth and say what it is that they want to do, and listening. I think we listen a lot, and therefore a lot of things that are required then get done. And with that, that's pretty much how we do it to sustain.
Thank you. I think with us is also open-mindedness. We know that we can't do it all, hence we are leveraging on the partnership with banks, malls. We realized that when we introduced these technologies, it became about them versus us. When people started making appointments, they would be serviced quickly, while you have an elderly person who arrived at 5 a.m., they had to queue. Hence, we leveraged on these partnerships. Now you have people who are parking in malls, being assisted. Those who don't have the technology, there are banks who are now developed in conjunction with us, taking our live capture software into the kiosk. They can do the self-service because they don't have access to those things. So as a learning organization as well, it helps. We also benchmark, and as they said on the OCDE, we also want to utilize the model that they utilized in Estonia, where all the services are accessible to everybody. And now with the branch expansion that we did with the banks, we only had 321 offices at Home Affairs. They have given us 440 to date. By December, we will have 750, which brings us to about 1,200 or so. That helps us a lot as Home Affairs to be able to provide the services that you require. It is for that reason that the President announced that we are now going to discontinue the Green ID book. And I hope no one has a Green ID book in this forum. You're all technocrats. So we are now looking at everybody having smart card, but also the yes, I'm happy. And also the introduction of the digital ID that I hope everybody who's a technocrat in here will help us to be the change champion when we introduce that. Thanks.
Good. Next.
eGov has a mandate.
What? What makes you...
Yes, eGov has a mandate. It makes it easier for us to implement that what is in our strategy. We do a Gimba, which is a Japanese word that basically means we walk around, we observe, we take action. Our political heads, whether you are ANC, whether you are IFPDA, we are all working together. So we have that support. It's unfortunate we don't have money, but we have skills where we are stretching our own internal resources. Thank you.
Thank you. I would say 3 things for us in the Free State. Often people talk about how, culture will eat strategy for breakfast, lunch, and supper. We've created a culture that allows us to take a lot of risks, and it's paid off. I was watching the videos yesterday as we were reminiscing on the CPSI awards, and I can tell you that, we've over the years, we've won quite a number of awards for the innovations that have come out of the Free State. So I think we've created fertile ground for innovation through the culture that we've cultivated in the department. The second and probably the most important issue is, of course, the willingness for managers to just support a different way of doing things that we do routinely. It's something that outlives any MEC, any HOD. It's part of what makes up the Free State Department of Health. I think the last thing is this whole thing around growing your own timber. I think for the longest time, especially in digitization, government has been taken advantage of by large vendors that have sold us systems that are very expensive, that we have not been able to sustain, and that have really not delivered value. The younger people that are coming into public service now are very skilled. They are eager to learn, and the partnerships we have with universities also allow us to create our own developers, our own enterprise architectures, our own cybersecurity skills, and that is something that we're doing in the Free State now. Most of the systems that are IP owned by the province are developed by young kids that have been through the pipeline from the Universities of Technologies to the partnerships with other countries, etc., etc. So I think those 3 cardinal pillars are what makes it work in the Free State.
All right, and Adim Langeni.
No, thanks, Chair.
You still have less than 30 seconds, right?
Yeah. Chair, thanks so much.
Wait a minute.
Thank you, Chair. I think for us, what actually is working for the province is the internal capacity that we have actually built as far as the development. The solution development basically happens internally, something that we actually proud ourselves for, and it allows us to build solutions once and replicate those solutions to other places. And I think it's one of the key things. And we also appreciate the support that we have from management, including from the political office. And I think it's one of the things that I think we can really proud ourselves with. And I think in the near future is that, the more we continue with this strategy, it will actually assist us to save a lot of costs as well. I mean, the direction that we're also taking in terms of also, getting into open source, it will also assist us to ensure that we reduce the issues of costs and so on in relation to licenses. Thanks, Jim.
Thanks. I suppose by management to Raborena so.
Yeah.
Thanks. Mayor Hamilton, you can start walking here. And ladies and gentlemen, it would have been a pleasure talking to you. The last message I want to say, when she finishes, I'm not going to come back. We will have tea for 15 minutes at 11:30. You can bring your tea back if the 11:45 you can bring your tea here so that we can finish on time. Thanks.
Thank you. Thank you very much, Program Director. Deputy Minister, I'll be reflecting on some of the issues that you were raising. But I think as CPSI, when we're putting this together, one of the things that we're saying was, let us showcase innovation. And through this panel, amongst others, one thing is clear. Department of Home Affairs mandate has not changed. Do you agree with me or you don't? Has it changed, Bab? It hasn't. But if you look at the journey that Home Affairs has traveled, from all of us going to Home Affairs regional offices to apply, to them having mobile units, to them having dedicated queues at those regional offices for mothers that has just given birth, to now having those mobile units in hospitals, but now no more mobile units, but having offices in those hospitals where parents, mothers now are able to leave the institution with a birth certificate. And they didn't stop there, because innovation talks to continuous improvement. Home Affairs did not say, we are folding our arms, we've done the job. And they continued. And where are we today? E-services that Osgrace was reflecting to it. And they still do the same thing. Birth certificate, identity documents, and travel documents. And the same can be said, for example, with SARS. So I think with that, you see how it doesn't end, it continues. And even the example that Dr. Nku was reflecting on, to say they moved from 77 minutes to 17 minutes, 10 minutes, and now they're average between 5 and 8 minutes going forward. So it talks once again to that continuous improvement that we want to talk about. Answering the question that the DM was reflecting on, and Mr. van der Walt, you've kept us busy. He asked the question, and that's what we do as CPSI. We don't take only these innovations and share them during the conference and we close, because it is a program. We then go beyond and run a replication program. SpeedyQ, I'll start with SpeedyQ. SpeedyQ has now been shared in Gauteng, and we are piloting that in 9 hospitals in Gauteng, with all the districts in Gauteng covered, from Academic Hospital, being Chris Hani Baragwanath Hospital, to all the different levels of hospital. CPSI is assisting Gauteng province to replicate that project. Limpopo heard about the SpeedyQ project, and they came to benchmark at Edenvale Hospital, and going back, we followed them as CPSI, and we then trained the entire Limpopo province on SpeedyQ, and we have 5 pilot sites. DM, you'll agree, we always complain, Pierre is here, capacity challenges. We can only do so much.
But the entire Limpopo province was exposed to Speedy Q, and we are having 5 pilot sites. And it's a process, how we do it. It's a hand-holding process, a CPSI. When we replicate, it's not a copy and paste. Because Speedy Q started at Edenvale Hospital. You can imagine the dynamics at Chris Hani Baragwanath Hospital or CMJA Hospital when we take it there. And as CPSI, we then help to customize that particular innovation to fit that particular environment so that it succeeds. And this is the question, DM, that we are asked by the portfolio committee to say, why do we only concentrate on certain provinces and certain institutions? And it's people like this. I must look at Babu Mlangeni. I'm meeting him for the first time, but we've been talking. And how we got to talk, it's because we are working with the SIU and NPA. And they said, CPSI, we want a performance monitoring and evaluation system. And we said, no, Limpopo has done it. Why should you continue to reinvent the wheel when an innovation has been found? You are wasting government resources in trying to reinvent the wheel. And Mr. Mlangeni and his team, we then had a virtual session where SIU, NPA, and Limpopo, we were all connected together, and they were sharing and showing them how it is done. And going forward is going to be a hand-holding exercise. On a lighter note, I hope I've got bulletproof protection. During the meeting, SIU is in the room, NPA is in the room. Babu Mlangeni, your team reflected on, because we are looking at integrating the reporting with DPME. So you said the person who they were working with at DPME to do the connection, the integration has left DPME. That person came to CPSI. As I move on. There's a lot that we can share. As CPSI, we are able to pick up the phone and call Dr. Nku as the hospital CEO. On an annual basis, when we have the Innovation Awards in November, I take all the health-related projects and I send them around. And she always stands up and says, count me in. I phoned Bandile of an innovation that will be presented after tea from the Western Cape. Bandile said, count me in. That is the nature of public servants that we require. And it makes it easy for us as CPSI to come to your institution and then support innovation and help you with replicating some of these innovations, as Mr. van der Walt was asking. How do we then move these innovations from just being a good practice in one institution and not in the entire institution? Last but not least, in Mpumalanga, we have an innovation minister, deputy minister that talks to what you were referring to, which is around the triage for maternity. It won a CPSI award. It's from Temba Hospital. And we are starting with the replication of that innovation in this financial year. And Mpumalanga Department of Health said, before we can move out, because Temba Hospital falls within Ehlanzeni district, that innovation will then be replicated to 30 facilities within the Ehlanzeni district. And these are the innovations that, beyond that, we've already shared. Gauteng has raised their hand, Edenvale, yes, Edenvale Hospital and the other hospitals in Gauteng, BGH, Lenasia, and a few others have said, we want this project. And this is the project that we will also want to take to the Eastern Cape. But I will say it on record. Public servants are not receptive, Deputy Minister. The leadership is not receptive. And as CPSI, we move with those that move. That should not be the approach, but I hope that being here, you have been motivated to say there's a lot that you can do. And we've had innovations coming from individuals. Bandile, we did a global green project. He was not even aware of the project. It was done at Bongani Hospital in Velkom. And it won a CPSI award. And when we called Bandile to say, here's an innovation, let's make sure that it gets streamlined. He made it possible by making all the resources available, and our minister then did a handover of that, because then Bandile and his team made sure that all the hospitals in Free State have got access to this particular system, and as CPSI, we then helped them with devices for over half of the hospital so that we kickstart the innovation. So there is a lot that one can reflect on, but I've tried as much as possible to cover the bases. Thank you very much, Program Director.
Ladies and gentlemen, tea is ready.
to different provinces. My name is Khatliso Hamilton from CPSI, and I know people have been asking, can I just get an indication how many people have downloaded the app? So once you registered yesterday, you should have received an email that tells you click here, and this is where you can then click on that to have access to the app. And it's a very innovative way because it has enabled the speakers to be able to also respond, because having a roving mic doesn't work all the time. But also for contact purposes, it serves a very important part. But not forgetting the most important thing. You are here, you can get your attendance, your confirmation of your attendance on the app. Okay? So just to quickly go through it, there's the QR code. You can scan it if you do not have the app. And I'll just take you through that, because even the presentations that were done yesterday, they are busy loading the ones for today. All those presentations are going to be there. So you have access to them immediately, versus us having to still go back and then put them on the CPSI website, which we will still do later on. But immediately, this is where you can then get those presentations. So if you're on the app, you click on the 3 menu bar, and on the different tabs there, you will see there's information about the speakers, people were asking about contact details and so on and so forth. And then on documents, that's where you'll have the presentation. So having said that, we are going to kickstart this session with innovations that won CPSI awards in 2025. And these are the innovations that further on have been identified as well as part of the replication program. And it's one of those one of the projects that reflected on it, on that project. And the first one, are you all sorted with the app? Okay, because then we are going to start flighting the presentation. So the first project, they don't like me for this, but I know they like me for the rest. I always say, when I talk to them, I always say government garage. Who knows government garage? All of you, ne? That's where government fleet is being managed. And Western Cape has given it a fancy name. What do you call it? Government motor transport. And it is government motor transport on steroids. Because the system that will be presented today, as I said, it won a CPSI award, and it's responsible for the life cycle management of the province, the whole province. So no department manages their own fleet. All Western Cape government fleet is managed by them. So they manage that whole province fleet, and this includes from procurement, maintenance, and disposal. So they even have auctions. I said they must invite me for their last auctions, but only for certain cars that I'll be interested in. So this is a system that was fully developed internally, in-house. And I would like to reflect on what Bandile said during the previous presentation. More and more we are seeing as the CPSI government departments having systems developers in their own department. Because many a time, some of these off-the-shelf solutions do not address the dynamics that we have within our country, and even worse, in our own provinces. While having it developed in-house and within the department, as and when things evolve, you remember we spoke about continuous improvement. If there's further customization that needs to be done, it's done internally. Versus off the shelf, you'll be told to open this, it's a different module. You need so many thousands to unlock it. So without any waste of time, I'll then hand over to my Western Cape team. to do the presentation. So these are government employees with personal numbers, and they developed what they're going to be sharing with you. Thank you.
Sorry, let's just get all our tools together. So good afternoon, honorable guests. My name is Nazreen Mohammed. I am a client liaison officer for Government Motor Transport. With me is?
Hi, good afternoon, everybody. I'm Zaid Permal. I'm a support coordinator for GMT as well.
Okay, he's the IT guy, guys. So first of all, thank you to the CPSI team for affording us this opportunity. Before we jump into the logistics of what it is we actually created, let me tell you a little bit about GMT, right? That's the acronym that we use, because in government we love our acronyms. So, GMT is a chief directorate under the Western Cape Mobility Department, right? We are a trading entity who provides fleet services to client institutions. So we have national clients, we have provincial clients, and we have trading entities, right? We have plus minus 6,500 vehicles in our fleet, right? We are the second biggest fleet in the province. We're not going to mention who the first is. But today's session, we're going to take you through the TV628. Oh, I need to remember to do this now. Sorry about that. So just a little look at our agenda. So we're going to do a quick introductory video, right? We're then going to look at the TV628 procedure process. We're going to look at the manual process, right? We're also going to look at the technology solution, which Zaid is going to speak to us about. We will also look at the inspection application, the health check dashboard, the business impact, and then the TV628 architecture, the app architecture, right? So let's do the video so that you can we play the video? Should I play? Thank you.
For every fleet, progress means moving forward with confidence. Vehicle withdrawals shouldn't slow us down. The TV628 inspection app transforms a once manual, time-consuming task into a seamless digital experience. And the results speak for themselves. Auction vehicles have surged from just 50 to over 180 a month, unlocking greater value for the fleet. Every inspection is smarter, every image clearer, every report instantly at your fingertips. With one view, you know what's happening, who's responsible, and that your fleet is in safe hands. This isn't just about inspections, it's about empowering people, protecting assets, and driving fleets into the future. TV628 Inspection App, inspiring trust, driving progress.
Thank you. All right. So, the TV628 digitization project represents a landmark in GMT's journey towards smarter, more transparent public service delivery. Faced with a paper-heavy vehicle withdrawal process that slowed down auctions and limited accountability, the team set out to re-engineer how government assets are assessed, documented, and retired. Under the leadership of the Repairs and Maintenance Program and in partnership with the ICT, Quality Assurance, and Enterprise Architecture, the team developed a mobile inspection application linked directly to GMT's enterprise platforms, including our fleet management system and SharePoint, right? Inspectors now capture data and photographs on site while automated workflows replace manual folders, paper trails, and physical sign-offs. Are we still on there? Yeah. This transformation restored confidence in the disposal value chain. Each vehicle follows a guided digital inspection path supported by real-time dashboards for validation, follow-ups, and audit readiness. Auction volumes have increased, processing times have shortened, and staff reported higher satisfaction due to reduced rework and clearer accountability. Very important. Beyond technology, The project exemplifies GMT's commitment to the Western Cape government values of responsiveness, integrity, and service excellence. It is replicable across other fleet processes and demonstrates how people-centered innovation can deliver measurable efficiencies, environmental benefits, and stronger culture of accountability in the public sector. Yeah. So, the TV628 Vehicle Inspection app was developed by GMT to digitize and streamline the vehicle inspection process. It is built in Microsoft Power Apps. It allows inspectors to capture vehicles' information, images, and inspection results electronically. The solution integrates directly with Fleetman, improving accuracy, accountability, and overall efficiency in managing the government fleet. All right. Let's just move on. So let's look at the process. We're just going to show you very briefly what the end-to-end process looks like, but we're not going to go into details because, yeah, we are standing between you and lunch. But this is what the end-to-end process looks like and what we based our digitization on, right? What we do want to go into, though, is our manual process, right? So under the manual process, we looked at the vehicle condition assessment, which is a TV628. The disposal process is the assessment and verification process undertaken before a vehicle is approved for disposal or sale, right? That's the process. During this process, the vehicle condition, maintenance history, and compliance requirements are required or reviewed in order to ensure it is eligible for withdrawal from the fleet. So we need to make sure that everything is in order before we put that vehicle up for auction. The TV628 pack consists of the vehicle assessment information together with supporting documentation and evidence that validates the details captured on the fleet management system. The first 2 pages contains the core TV628 information, while the remaining documentation provides supporting records and approval. This document forms the basis for the online auction process and helps ensure transparent, compliant, and well-documented disposal of government assets. Given the prospective buyers rely on this information provided, the quality and completeness of the documentation is critical. All right. So there are 2 types of processes. There we go. The vehicle inspections are categorized into 6 different types. However, today we're only going to look at 2 of those processes. It is the ordinary, mechanical, and accident inspection, right? An ordinary inspection, which is the one that's flighted on the screen right now, refers to the vehicle with no significant mechanical or cosmetic defects, right? While an accident inspection relates to a vehicle that has been involved in an incident and requires additional assessment and support documentation. Although ordinary inspections are among the simplest inspection types, right, the previous process was still paper heavy, right? A single inspection pack typically consisted of 14 to 15 different documents that could range from 46 to 96 pages for one vehicle, right? As shown on the screen, these documents had to be sourced from multiple systems, files, and records before being consolidated into a complete inspection pack, making the process both time-consuming and administratively intensive. So this is just a normal ordinary. If we move on to an accident, right, and mechanical inspection pack consists of all the documents found in the ordinary inspection, so all that 96 previous documents, with added documents, reports, and pictures, such as highlighted in the screen above. Accident inspections packs previously consisted of 19 documents, which could be anything from 84 to 235 pages, depending on the vehicle, right? Documents needed from Fleetman had to be retrieved from different tabs, which opened up the multiple windows. All the documents required manual printing, so you can imagine what that looked like. But the pack was also too heavy for staples to penetrate, or even a paperclip struggled to keep the bulky pack together. So I'm going to hand over to Zay to talk through the technology solution a little bit, and then I will be back.
Thank you, Naz. So if we look at the next slide, that will be, if you can have a look there, that's our complete solution there. You can see it's all integrated digital real-time processes. So, everything starts with a vision. And I think the vision that GMT had was, we were tired of working hard and perhaps coming up with smarter solutions in order to do the job and get the job done. So we envisioned a complete digital platform, everything integrated into one. One that connects the procurement, the inspections, and also disposal. We wanted to be mobile to boost the workflow and also to have a complete oversight on all our processes, integrated everything into one. The next slide you can see is the vehicle replacement solution overview. So in order for us to create an integrated digital fleet management system or ecosystem, GMT, we assess the end-to-end processes at our hands, spanning from procurement to vehicle inspections and also disposal. From this assessment, the TV628 app, inspection app, was identified as a priority initiative due to the complexity and also the governance requirements associated with vehicle disposal. The disposal process serves as the final control point in the fleet life cycle of our vehicles, with data and decisions from multiple upstream processes feeding into it. By digitizing this whole process at this critical stage first, GMT then could establish a strong foundation for future integration for our systems while delivering significant operational and compliance benefits. Let's journey just into the TV628 inspection app and how it all started. So it all started by reviewing GMT's current state and the processes. GMT assessed the problem. We then defined the desired state and also implemented the solution that what directly improves how government serve its department as its citizens. While assessing the problem, GMT looked at what we needed to change in order to speed up the process. The desired goals were to capture all our inspection questions digitally, take clearer pictures that link directly to each question, and also generate a TV628 PDF document that automatically eliminate manual retyping by integrating directly into our fleet management system, which has been custom designed according to GMT's operational requirements, and it also hosted in Oracle Cloud Technologies. The applied solution was the above deliverables, you can see there. It was the TV6 inspection app, which was then developed, also integration into our fleet management system, and also the final one, which is the digital copy of the reports, which was saved to the SharePoint. The value added was there was efficiency by reducing inspection time and also the manual paperwork, and also accessibility due to the mobile-first design, which gave inspectors the ability to do inspections at other sites and not be restricted just to being in one place at one time. Naz, over to you.
All right, guys, back to the ordinary and the accidents, right? So when we look at the TV628 app, right, it reduced the number of documents needed, which automatically reduced the page count per pack, right? So this speaks to the sustainability due to the paperless process that supports our environmental goals. An ordinary inspection went from 15 to 11 documents while still providing all the same information as before, and that is important for our audit, right? Previous page count used to be anything between 46 to 96 pages. Now the maximum count is only 32. All right. Let's move on to our accident. It's always going to be more. So when we compare the accident inspection process before and after digitization, the improvement is significant, right? Previously, an accident inspection pack consisted of 19 separate documents and could range from 84 to 235 pages, as mentioned earlier, depending on the vehicle and the supporting evidence that is required. Through the implementation of the app, the process optimization, the inspection pack has been reduced to approximately 16 documents with a maximum page count of only 59 pages. This demonstrates the value of digital transformation. The maximum size of today's inspection pack is now smaller than the minimum size of the pack produced under the previous manual process. Right. Importantly, this reduction has been achieved without compromising information quality. The solution still captures all the required information and in many cases provides richer data, supporting evidence through a more structured and efficient digital process. So we're going to go into a little bit of detail. We just want to talk through the high-level process, so please bear with us. So, before an inspection can be conducted, it is assigned to a designated inspector through our fleet management system, right? Once the inspection has been allocated, the inspector automatically receives an email notifying, advising them that an inspection has been scheduled. This ensures that inspections are tracked, assigned, managed efficiently from the onset of the process, right? Everybody knows what they need to do. Next, there we go. When the inspectors log into the application, they are presented with a personalized dashboard displaying all the inspections assigned to them. The allocation process provides flexibility and operational continuity. If the assigned inspector is unavailable, the inspection can be quickly reassigned to another qualified inspector. The newly assigned inspector automatically receives the email notification, ensuring timely completion of inspections and uninterrupted service delivery. So we don't need to wait for someone who is on leave to come and complete an inspection, right? Next, after the inspection is scheduled, it will appear in the inspector's to-do list. The moment the inspector starts the inspection by clicking on the Start Inspection button, the next screen will appear, starting Section A, where a set of questions are asked that aligns with our fleet management system to capture the requirements, and also prioritizes taking pictures where it is needed. The VIN and engine number automatically pre-populates from Fleetman. So the importance of this is that if your VIN and engine number is automatically pre-populated, you limit the typos and the finger errors that can occur, right? So if there is a license disc, you can click on the scan disc button and the details on the license disc get scanned to verify the pre-populated information. If there is an error, the details will appear in red. So immediately the minute the inspector scans and there's an error, it will show up, they'll be aware. If it shows the exact angle at which the pictures need to be taken, and if you click on the camera icon, it will explain exactly how each picture needs to be taken. The moment Section A has been saved, you will be able to see the other sections, right, as shown in display 4. This one on the side, right. As well as if there's any reports that is needed. If anything that is required is not added, the app will highlight the section in amber, so you're unable to move forward. The moment everything is entered, it will highlight in green, indicate that the section is completed, and it will have a green tick next to it. If there is not a tick next to it, it means you have not entered the section correctly, right? If there is not a green tick next to all the required information, it will gray out the submit button to avoid submission that does not have all the required documentation, right? So it prevents the completion of the inspection if all the necessary documents and information is not added. So that is a security measure. Right, let's move on. Right. So that the app does not only allow capturing the needed data to Fleetman while taking pictures simultaneously, it also automatically generates the required reports based on the inspection type. So whether it's an ordinary, accident, or a mechanical that was selected. The app has 3 different tabs: the To-Do tab, the In Progress tab, and the Completed. Supervisors can also monitor progress, right? So the To-Do tab shows the inspection scheduled but not yet started. The In Progress app shows the inspection started but has not yet completed. And obviously the Completed has a list of all the inspections completed by the specific inspector for record purposes. Once the inspection is completed, the answer to the questions gets integrated into our fleet management system, which captures your TV628, and all the reports and pictures are submitted to SharePoint. There we go. So to sum it all up, inspections are now more mobile, reports are automatically generated, emails for missing tools are pre-populated, and data flows into Fleetman and SharePoint. This reduces errors, it saves time, it eliminates printing, which supports a greener government. I'm going to hand over to Zaid now to take you through the technical dashboards. Thank you.
Thank you, Naz. Okay, so these are known as the operational dashboards, which is created through Microsoft Power BI, and also the Apex Health Check dashboard, which is also hosted in our Fleetman system. And the benefits of these dashboards are they are real-time data refreshes, Also quick valued accessibility to our Fleetman data. Oops, sorry. So those are the dashboards. So the one there on the left, that's the one that's in Microsoft Power BI, and then we've got the one on the right, which is integrated into our Fleetman system. Okay. The health check dashboard, it's a single screen that displays all the data that previously needed about 5 to 6 different screens and documents to check, and it could identify the possible reasons to reject any TV678 document pack. It displays the info previously searched for on multiple documents such as the viability report, our vehicle identification, and also allocation pages, fuel reports, technical history, and also log sheet reports. The graph shows the mileage of the vehicle over time, just to ensure that the mileage is actually correct without having to go through to multiple reports. But if the graph shows that the mileage has declined, you can easily enter the reports via the Power Dashboard BI. Okay. We also have the operational dashboard, which allows for real-time shop floor visibility, enhanced decision-making, increased accountability and transparency, and also improved operational efficiency, strategic insights and monitoring, and also the ability to strategize as monitor. As you can see, the dashboard has powerful filter capabilities, which allows you to filter by inspection status, also to see what's still to do versus what has been completed. You can search by the make and model of the vehicle to obviously focus on the specific brand, type of vehicle, by the GG number, and that is to track the single vehicle progress. You can also search via the inspection type, that is to monitor the amount of ordinary vehicles compared to the amount of accident vehicles. Or you can also search via the inspector, and that is to see the workload and progress. So if you're inspector and you have anything assigned to your name, you can see what task is due by you. And also this gives us complete visibility and control over the entire process. The operational dashboard also shows a count of vehicles per inspection status, the Fleetman submission status as well. It also shows us a count of inspection schedule per inspector and inspection type, which also needed to ensure that the allocation of our vehicles are actually balanced. The operational dashboard also gives us a detailed view of all vehicles scheduled for inspection and the respective inspection status, and this also allows you to see how far the completion inspections are. So you'll see there in the green, the 100% that has been completed, in red will be not started, and also the amber, which is still in progress. It also shows you where the holdup is. It allows you to see when each section in the inspection process was completed. So as you can see there in green, all those tasks has been completed. So to sum it all up, the operations dashboard is a great tool for reporting, whereas the health check dashboard comes in handy when having to recommend or approve a TV628 inspection or for auction. These dashboards give us real-time visibility into inspections and also provides an audit trail which shows transparency. Managers can track progress, they can reallocate tasks, and also ensure accountability. These dashboards help identify issues early and also validate data and streamline the approval process. They can empower decision makers with insights, improving responsiveness and also service quality. Just Naz will give us an overview of the business impact since the inception of the TV628 app.
Okay, guys, so there was a question earlier about our auctions. Our auctions are done online, so if you're interested. So because we adopted this process, right, the inspection app increased the number of inspection and reduced the number of time taken to complete these inspections, which automatically increased our auction volume by 130%. Where we were using the manual process, and in 2025, which was where the app came into play, as shown on the graph. So you can see from 719 in 2023 financial year to 1,657. What this means for you is that we have more cars to sell now. Okay. So this also means better service, faster decisions, and more efficient use of public resources.
Okay, so I just want to give you an overview of the solutions architect for the whole setup of our system that we have available. So the TV628 Vehicle Inspection app is not just a standalone mobile app, as you can see above. It's an end-to-end enterprise solution built on our Microsoft Power Platform and integrated with our fleet management system, SharePoint, and Azure services. So as you can see, the architecture consists of a few things. We have there the Power Apps, which is the presentation layer, which is for the mobile inspections. We also have the Dataverse, which is the data layer, and that is obviously for inspection records, the business rules, and the workflow status management. We also have the Azure Logic Apps, which is obviously for the integration layer, and that's for any API integration and workflow automation. We also have SharePoint Online, which is managed by WCG, the Center of E-Innovation. That's our document layer for all photographs, reports, and evidence storage. So everything is stored into SharePoint. Fleetman, which is the Oracle system of record, and that's the authoritative fleet management platform. So this is just a brief overview of the solution and the process flow. I don't think I'm going to have enough time to go through it, but you can just see the process flow summary there on the left. So the process that begins in our Oracle system, which is our fleet management system, and it obviously ends in the fleet management system, which is our system of record. Next slide. So as you can see on top there, the solution starts in our fleet management system, which is the system of our records, where an inspection work order is then scheduled, is then assigned to an inspector, which is then in the Power Apps. The Azure Logic Apps integration then flows and orchestrates the request, and it writes it into the Dataverse, where it's then surfaced into near real time for the Power Apps front end. The inspector executes the inspection on a mobile device, capturing structured data through the app with offline capability data capture as well. And the supporting evidence and all photographic attachments automatically persisted through the SharePoint document libraries. Inspection reports are also generated automatically from the captured Dataverse records, and the completed inspection payload is synchronized back into the fleet management system via the same integration layer, closing the loop end-to-end with no manual rekeying. Thank you. Kagitsa, I'm not sure if we're going to have time for the short video. Or yeah, it's a short video. If you can just play the video. Unfortunately, we're supposed to do a live demo, but due to some technological constraints, we weren't able to do that. So we're just going to play you a short video. I know that's about 10 minutes long. But we'll just fast track it a bit. So everybody can see. So that is the process that we started. Previously, when my colleague Nazrin, she explained to you, so that is the beginning of where it's normally signed through our fleet management system, and that is then assigned to the inspector. That inspector will then get that email notification, and it will automatically then log into Power Apps, and it will begin the process. So normally to start the process, you always need to scan the license disc or the VIN number, and once that data is then captured, it automatically pulls through from our fleet management system, and it pulls through to our Power Apps, and all the vehicle's information will pull through. License, expiry of the license, VIN number, the make and model, the year, etc. So this is the process where you will just have to go through, select, retrieve the valid information of the vehicle, add your pictures, if it's the vehicle has the right wheel, the left side of the vehicle, 360 degrees photos from the vehicle as well. You have to upload pictures of the licenses, wheels, boot, the engine, everything. But we can just perhaps move on a bit, because it's about 10 minutes, I think, that video. So we can just forward on to, I think, about 7 minutes, if possible. Loading. Okay. So further on, you will once the photos is completed, it will bring you through to this page, which I explained earlier, so you can see what has been completed, what has not been completed, so you can track the progress. And obviously, you can't complete it unless every step has been completed. It will show you, it will give you the green, it will give you the amber, it will give you the red. And then also you can search as well. That has been pre-populated as well. And that's the way we designed the app as well. And then this is the condition, the report of the vehicle that we need to upload. And you can select if it's a burnout, if it's in fair condition, if it's been in an accident, whatever the condition of the vehicle is. And once this is completed, you will then save. It will then show you that the progress of each section has been completed. Everything needs to be obviously be in green. Once that is in green and it shows 100%, you can then click next and it will upload the document to SharePoint and it will generate the PDF report for you. And you will complete. So as Nazrin, my colleague, explained previously, the pack used to be about that big. And with this whole process, it's about that now. So we're looking about 20 pages maximum. So it's quite a lengthy process, but it works well. The report has been completed now there. It's just loading. And all these details that's in the system is obviously verified with our fleet management system. Yeah, I think we're done. Thank you.
All right, thank you very much. Yeah, that's it, that's our presentation. Thank you. Okay, so there are some questions on the chat. After, okay. Thank you very much, everybody.
Thank you very much. I won't spoil it. Instead, I will read what the comments say on the app about the presentation we've just had. The answers, they will answer those questions during the Q&A after the next presentation. The first one says, very impressive and powerful. SAPS and Health should embark on this as they have the most fleet in government. I can say Free State Health has raised their hand. I'm putting eGov on the spot because you are here and I'm looking at you in front. I hope we'll do the same for Gauteng and Limpopo and Dr. Setlapel, that we move this to the other provinces as well. The system is actually what the entire country needs to change government fleet. Please share your details for further engagement. That's interest. And it shouldn't end here. And that's when we talk about the replication program, where we say, these are the best practices. You know the deficiencies in your own department. Why should you reinvent the wheel or try and work things out yourself if best innovations have been found? The next presentation, so we'll have the Q&A for this presentation and the next one after Ron's presentation. We've been doing a lot of ICT. The next innovation, remember, innovation is not only ICT. Innovation is both ICT and non-ICT. And for this, in presenting the next project, I'll tell you a story. If you trust the people sitting next to you, you can close your eyes. Imagine a school that has a schoolyard next to it, school grounds next to it, but the school grounds are a dumping site. The school does not even know that that dumping ground belongs to the school. The community is just dumping on that part of the school premises. And we spoke a lot about design thinking. And that's what kickstarted what Ron then did. Because this innovation touches, that's where some of the work started. It redefined how education for sustainable development is delivered in the under-resourced communities. And what makes this project truly innovative is the integration of behavioral economies, principles, and incentive structures to inspire learning, shift mindset, and drive active participation among school learners. I think it must have been 2 weeks ago when I saw Dr. Naledi Pando saying, Maths Lit must be scrapped. I don't know how many people saw that interview. And what Ron is doing is pushing kids to adopt and grow more interest in the STEM subjects that we are talking about, using no innovation, but touching on different mandates from different departments. He's from Environmental Affairs, but works with Department of Education, and you will start seeing different elements in the project as he presents agriculture, different activities taking place, and he will finish up the story, what happens to the school grounds. Ron, you can come. Please clap hands.
Thank you very much for the presentation. My name is Ron Mukanya. I'm also from the Western Cape, so I'm very grateful and thankful to my colleagues from GMT for what they've done. It's made my life a lot easier. I just sign off by the click of a button, which is very helpful. In my presentation, I'm going to focus on the person. So just for context, whilst the slides come up, the Western Cape's population is about 7.6 million people, so just under 8 million. 16% of that is in our education system, though, so that's plus minus 1.3 million. That's in the government education system. I'm excluding the private schools. As a provincial government, we own close to 1,500 schools. So we're a landlord of these 1,500 schools across the province. More than half of those are in the metro, they're in the city of Cape Town alone. So the bulk of our learners are actually in the city of Cape Town. And a lot of those schools are under-resourced, so the bulk of them will be in quintals 1, 2, and 3. And post-COVID, some of the quintal 4 schools are also struggling. So we asked ourselves a simple question in the province, that what if a bag of recyclables is brought to school? And that bag can then improve environmental learning, and it can also generate much-needed income for the school, but then support local job creation and help build infrastructure in the respective schools where we are doing that. So that's essentially the idea behind the project. And for us, we felt that one school bag can then become the connection towards learning, livelihoods, and infrastructure, which then alleviates the burden that a lot of our no-fee paying schools are currently under. So we are all well aware of most of the challenges that we have. I'm not necessarily going to talk through all these bullet points, but we know inequality still persists. We have a decline when it comes to the STEM plus art subject participation. Youth unemployment is a big problem. Food insecurity is another challenge. And when it comes to public housing, the quality of housing has been a big challenge and a big problem for a while. I'll move on to the next slide, and I'll have someone assisting me in that video just to explain some of the context. If you can play the video for me, please.
Nelson Mandela dubbed South Africa the Rainbow Nation, yet it remains one of the world's most unequal societies. Nowhere is this more obvious than in township communities like Philippi. In Philippi, there are so many obstacles that prevent students from learning and staying in school. Everything from being too hungry, sick, or scared to learn has led to a dropout rate of over 50%.
So in our context, that dropout rate of 50% is too high. We then undertook the journey of looking at food insecurity for for school-aged going kids in the province. And we compared ourselves, or we benchmarked ourselves to what's happening across the rest of the country. And you can see the Western Cape has regressed for valid reasons. We are mainly a tourism revenue generation province. And obviously, COVID has sort of impacted some of the jobs that we had, and that's accelerated food insecurity. And we all know the saying that says, you can't teach a hungry child. And as part of our approach, we then undertook a few aspects or activities that I'll speak to later. I'll briefly zoom through these slides. This is a national survey that was done across the country. And just keep an eye on all the red blocks. So litter and rubbish were red. You look at the next one, ocean and beaches, it's red. You move on to the next one around energy and the environment, we're red. You look at the one where water scarce country, as we all know, we were also in the red. So I think for me, there is a problem there that we're not environmentally aware and we're not doing enough when it comes to environmental literacy. And I already alluded to this when it comes to government housing projects. So in part, what we were trying to do was, as a Cape or as the Western Cape, we have an economic risk, mainly for tourism and fishing. So if you look at our economic trajectory in the province, we generate a lot of our revenue from both tourism and fishing. And we have a lot of employment that happens in those sectors, but there's a risk to that. I was on Blowback Beach one day, and this is the photo that I took. And we all know no tourist wants to come to a dirty beach. So for us, there's a risk there in terms of people saying the Western Cape beaches are dirty and we don't want to go there anymore. And we can't afford that, especially under the current unemployment pressures that we have. There's research that was done by UWC. And one of the standout comments for me is people were saying they litter just because government doesn't care. And for us as the Western Cape government, we've got a direct interest in changing that narrative. Moving along, I've got another video just to highlight that cleanups are not sustainable. We need a different solution. If you can play that for me, please.
Come and join us.
We are a group of members of parliament looking at the nature and the extent of the pollution this plastic are making in our country. We have taken a view that we need to do something. We need to lead from the front as members of the legislature. We must cascade this down to our locals. That's why we said let's start here today to make sure that our communities then they know that they need to collect this waste and make sure that it's disposed in a proper way.
The goal is to be part of a forum where we can have discussions around issues that are impacting the environment, contributing to climate change, etc. And it's something that I think this grouping of parliamentarians working on a non-political basis is committed to trying to achieve and seeing how we can achieve that through effective legislation.
I think it's a good thing that elected public representatives start leading by example to ensure that the environment is cleaned up and that everyone else follows suit and start thinking what's in the best interest of the environment.
The members of parliament, we have discussed this issue of lack of waste management policies, especially at local government level. So it's high time that we need to educate our people. One, to inculcate a culture of ownership. Two, that the municipalities must make sure that this rubbish and everybody must be able to clean their immediate environments.
So the first comment that was made that we need to inculcate a different culture is effectively what we are doing with our project. If we move on to the next slide, we had the National Minister visit us. I think it's National Minister 4 versions ago, but let's just play the video.
Today we are observing World Environment Day under the theme Beat Plastic Pollution. Obviously today what we are primarily interested in is the question of what do we do with plastic. We know that every year there are about 2.5 million tons of new plastic products that are produced in our country. And because of some of the complexities that exist with regard to waste management, we are concerned that almost half of the new plastic production is leaching into the environment. It is affecting our water supply, our wetlands, our land management, and ultimately it's going into the sea where it's impacting on the fishing industry, which is a significant industry, particularly here in the Western Cape. What do we do with chip packets? Chip packets are my worst because nobody wants chip packets. What do we do with car bumpers of vehicles that have been involved in accidents? What do we do with polystyrene? And what you can see is in this particular project, all of this plastic waste is being recycled and is being used as a product that can be mixed with cement and building concrete.
Right, so moving along, I already highlighted this. If you look at our number of tourist visitations last year in the Western Cape, we reached a record level just over 1.1 million. And would like, obviously, to continue that trend, but it means we need to look after our natural environment and look after what brings people to the Cape. So moving along, what does our model do? We've integrated different aspects into the curriculum, and we are simply using our schools as an entry point. So the existing curriculum allows us to do that. And I'll move on and just highlight some of the aspects that we are dealing with. So we are a school-based secular economy model. We own all these schools, so they give us that scope to be able to use our schools as active living laboratories. And a lot of the schools that come on board introduce either an eco club or a science club or environmental club, just depending on the name that they want to call it. And we've established a broad public-private partnership to also implement, so we don't solely rely on our own budget as provincial government. And what we've done is we start by capacitating our teachers. So we've got a program that our teachers attend at our provincial training institute, and they get continuous professional development points for that. So there's an incentive for them to undertake that training. And then when they leave, they then go and implement that at the schools. And ideally, those are the schools that we then start rolling out our program or our intervention at. So for us, sustainability starts with teachers, and I've already highlighted this. So our main driver is the STEM subjects. We want to see our learners doing more in the STEM field. I think there's a lot of opportunities that we have in the province that they can take advantage of. So we are thinking about skills of the future. And we've gone as far as developing a very low-tech e-learning Moodle-based course, which is hosted at our training institute. And again, this is just us collaborating with our provincial Department of Education. And we have a course for each term. So if you look at your grade 4 to 6 natural science, we have stuff on life and living, we have stuff on meta and beyond and the like, and that's kind of how we've mainstreamed this into the existing curriculum. We also do things around energy and change, so we train up our teachers on this, and this platform is available to them for free. We then move on to the learners to get involved. So the teacher is confident to do this. We then fund a containerized recycling station. We also support where we have more seniors in the community. We put a tricycle, and what that then allows us to do is the seniors just send a WhatsApp request for the tricycle to come and collect recyclables, and they give us like an hour slot. Similar thinking to what Checker 6060 does. That's kind of the model that we've adopted, but very low tech. We're simply using WhatsApp, nothing fancy. And then the recyclables come to the hub, We sort them by type, we then weigh them, and when they reach a certain quantity or volume, we then call the buyers to come and buy, and the income comes to the school. And this is just an illustration of how the system works. So the black arrows is the movement of the recyclables going to the school, and then the yellow is the incentives that the households that are voluntarily participating in the learners get. And I've already touched on the aspect of door-to-door collections, which we do with the trikes. And this is just an example of bags that we filled. So those are 1,000-liter bags full of recyclables. They are waiting for the collector to come and collect, and then the money goes to the school. In certain instances, our school fences are vandalized. So this is another school in Langa, where the fencing had been vandalized and they were dumping. We got there, we cleared all of this, we refenced it, and it hasn't been vandalized since. So it's that concept of fixing one broken window at a time. And then I will just briefly touch on the school that we call Webnastrat in Afrikaans. In English, it will be Webner Street Primary School. Just to touch on the aspects that were hinted on in my introduction. So it's an off-fee paying school. It was once fenced off, and then the sports field was vandalized. Then we had 500 homeowners within the vicinity of the school signing and sending a petition to provincial government to close the school. And what I found interesting was some of the people that signed the petition either had learners that went to the school or a family member that went to the school. So I found that very odd. But anyway, the concerns at the time was this sports field had become an illegal dump. There were drugs that were being sold, and a whole lot of other socioeconomic issues that were being perpetuated because of the vandalism. So on the left, that was the school before it was vandalized, and then on the right, that's how the school looked like. I won't say much because I think in the next, okay, then this is an article that's available post our intervention, but then I'll move on to the next slide. This is some of the things that the learners at that school are doing, thanks to us intervening and bringing this project there. From a gang prevention point of view, the school was an ADT client, so we negotiated with ADT to use the school as a holding pad, so when they're not responding to triggered alarms within the vicinity or in the area, they park their vehicles at the school. So since we've intervened, the gangs haven't come back, which for me is a positive. And then moving along, the principal will also just briefly sell the benefits and some colleagues, and then we'll move on to the next slide. If you can play the video for me, please.
The first time when I got to Webner Primary was in June 2022. When I arrived at the school, when I walked onto this field, I found people living on the school's field. I found about over 80 tons of waste that was dumped on the school field. There was various gangsterism, drugs, a whole lot of other criminal activities on the school field. We then came in, we removed all the rubble, which accumulated up to 84.5 tons of waste that was dumped at the school's sports field. Then we had land invasion here to remove the people that put up structures here to live on the school's field. The whole community is then started recycling. We got the school a little recycling center where the community donates all the recycling to the school, and in return the school sells the recycling to make more money that goes back into the school itself and into the learners.
You know, a lot of kids didn't really see this as part of the school because of the fence that separates the field from the school itself. And once they realized that, but the field belongs to the school, and at some point we will be able to use it, learners started to get excited. And this whole recycling project we actually boosted it by getting the kids involved, giving them incentives. Let's see who brings the most recycling to school. And the garden is also used for educational purposes. The kids go into the garden, they get explained what is going on. They were told about the recycling of water, because we have a JoJo tank in front, catching the water from the gutters. They realize basically that my food comes not from Pick n Pay, but from the garden. And they see it grow. And they eat the stuff that grows from the garden. We have spinach in the garden. We had beetroot in the garden. We had cabbage in the garden. We now currently have potatoes in the garden. We have tomatoes. So our garden is expanding. And our kids benefit all the way from everything that has been happening at the school since this project started.
Yeah, so that's a garden on sandy soils. If you've been to Cape Town, you know we've got a lot of beach sand. And yeah, it's like that in most of these areas. This is just an example of a grade 1 learner coming to school with their bag. And they told Dad, you know, I'll carry my own recyclables. You can carry the school bag. But what we also do is, as incentives, if the learners are struggling with school uniform or shoes, then they get rewarded for that. So at least the learners know that there's a benefit for them as well. We create local employment opportunities. I'll just allow this short video to be played and then I'll move on swiftly.
It's Justin Alexander, and I'm at the moment with the schools project. We collect waste and all kind of recycling stuff for the school. The problem is, you see, nearby the school, the people dump the stuff, and we're actually here to make a difference in that. That's why we go house to house to collect recycling if people are involved with us.
So do you knock on the doors?
No, they actually WhatsApp us and tell us we can complete.
Okay, so there's like a WhatsApp group where everyone in the neighborhood is like,
also, yeah.
okay, this is what we need to come collected today. And then what do you do once you've collected the waste?
I bring the recycling to the school and they sort it out by the container.
Okay, so do you sort it out or is there a different?
There's 2 ladies that sort it out, and when I'm not collecting, I help them.
Yeah, so at this school we created 3 new full-time jobs because of this. And as you can see, those are bales that have been baled, so they look nice and sightly. Often people say recycling on a school premises looks horrible. It doesn't, if you ask me. This is just a collection. So at some schools, these collections happen on a daily basis. And when I see that, I'm always happy because that means money is coming to the school. And we can use that money to fix a broken window. Alternatively, vary the very standard nutrition program diet that's provided. Moving along, we also have soup kitchens at a lot of these schools. So we bring in what we call bokashi composting for the organics. And then we then use those organics to feed the gardens. Because of our sandy soils, we had to try and find a very low cost way of continuously feeding our kept sandy soils so we can produce food. And this is just an example. So the school that was in the video, Webna, this is how their garden looks like. And on the left, so this garden, also sandy soils. On the left, that's excess bokashi composting that they've made. And because it's excess, they then sell that. So it's extra income again that the school gets. And a lot of this activity, it's the learners doing these things after school. And then we move along. So I'll move on to the reason why we do these as after school programs is in the Cape we're in the news for the wrong reason. So gangsterism is real. And for us, after school activities give us the opportunity to hold on to our learners long at school. And by doing that, we are depriving the gangs to have time to be able to recruit them, which is why we are working in a lot of these gang-ridden areas. So all this work, it's not being done in the fancy Lani schools at all. It's not your Camps Bays, and no, it's actually the other side of the N2 and the N1. And again, like I said earlier, it's normally quintals 1 to 3, which is the under-resourced settings. And that's just an illustration of what the learners are doing. And in some of these schools, we have learners that are coming from homes where the parents are drug abusers. And that behavior then shows itself in school. And often what the teachers will do is they'll kick these learners out of school, out of class. But because of this program, we find that a lot of those learners are on a journey and a path that's different to the behavior that they used to have before. And what happens to the difficult to recycle plastics? We've got an end use for them. Some of them, they come back and then they build the very same schools. We go through this very low-tech chemical process where we infuse the difficult to recycle plastics into building materials. If you look at block A and B, who can tell me which one is plastic from that look and feel? Anyone willing to guess? Why B? Too smooth and shiny. Yeah, good point. And it looks lighter, not darker. Good point. So there's 10% plastic hidden in that one. The impact and the effect of that plastic is, that block is way stronger than block A. So in the Cape, our winters are very harsh and there's complaints of rainwater ingress coming in. But because you have plastic on that, it acts like the skin. So the water stays outside. In summer, your homes are a lot cooler because it retains your cool air inside the house. So we have a better product. And then moving along, just a short video from, this one is a high school. The earlier one was a primary school. So this will explain some of the points from a high school point of view. And then I'll move on swiftly to my last two slides. The whole point of the program was just to make recycling a lot more accessible, especially within communities like this one where recycling is not the norm. We've got 1,500 schools as the Western Cape government, so obviously from a land point of view, which is very expensive, it then just makes it a lot cheaper and convenient. And again, we're supporting learning and we're supporting the curriculum, but we're also enabling the schools to earn an income. At present, we're actively involved with plus minus 14 schools. A lot of these schools are pretty much no-fee paying schools, so they are the higher quintile schools if you look at our ratings. And we've got a waiting list or a pipeline of plus minus 17 schools also that have expressed the demand and the need for similar programs.
I feel blessed the day when this project, the recycling project, crossed my path, because immediately I identified a lot of needs in our school, and we know that the department cannot always foot the bill in terms of what we want in school. So we as principals need to be creative and find other ways of getting funds into our school, because the goal is to become excellent schools and making sure that we can ensure a future for our learners. You know, I'm at that stage where I look at a chips packet and I say, wow, that's money. A project like this can also foster a sense of community, because it's not only the learners and the schools and the educators, but it includes all the stakeholders. So no use complaining about the state of our communities. I think this is a vehicle where we can basically look after our own environment and make sure that it's clean and it's healthy and it's safe.
Today we are here at our first recycling facility in South Africa. We developed a process whereby we can take all types of plastic waste, resins 1 to 7, and process it into an eco-aggregate, which we can then use in the production of various concrete products. The program basically incentivized schools and also people from the public with some of our informal waste collector partners to collect plastic waste into these bags. Once we receive these bags, it goes into a shredder. We then shred it and granulate it into 6 to 7 millimeter flakes of plastic flakes. We then mix it. There's a little bit of a mixed design between hard, medium and soft plastics. And then we add 2 mineral additives into the process. We put it through a mixer, and then it's run through an extruder, whereby we then extrude a hybrid mineral polymer called Resonate. It comes out in the form of a sort of a 20 millimeter diameter sausage, and then it's granulated into a gradation of between 6.5 millimeters and smaller, similar to a normal crusher dust that's used in the manufacturing of various construction products, like for instance bricks, blocks, pavers, curbs and channels, pipes, etc.
The moment that we receive the Resonate is taken to the mixers. We then enter the material through the scales, which is our cement and our normal repurposed material that we throw in. We add about 10% in terms of volume.
The mixer is then mixing it for your appropriate amount of time, depending on what strength you are dealing with. It then goes through to the hopper, it's thrown into the press, and then it goes to the curing chambers. The curing chambers, it is left to cure for about 12 hours. After that, it's manageable. In terms of structural or strength differences, we've made about 1 million bricks by now. We've been doing this project for the last 2 years. And we have actually found in our internal results that we get better strengths with the Resonate, which was also a bit of a surprise to us in the beginning, but that's what tickled our interest so much with this. The quarries itself is running out of material. The quarries are also becoming further and further away, which adds another cost to the whole process. And that's why crushing of material has become so much more popular as time goes on. And there's a shortage of material. What the Resonate provides is a security of supply.
We are currently on a site in Khayelitsha, Lita Park. And we are building backyard flats for a potential homeowner of ours. So we are building with Resonate blocks as well as Resonate floors and foundations as well. So on average per site it's about 22,000 bricks, which equates to about just under 6 tons of recycled waste that is taken out in the environment and crushed down into the fine aggregate that is put into these bricks. We have built about, I would say about 50 properties, which is about 380 units. We're aiming for about 500 units towards the end of the year. There's a big misconception when it comes to green building and green materials. Your immediate thought is it's a whole lot more expensive. How can I get this product within the townships? People immediately also think it's more inferior because it's built with plastics, but inherently it actually has a lot more better properties as well.
Yes, so in my closing 5 minutes, you can see we're building homes. We're also pushing the limits in a lot of backyard dwelling, where we're actually building backyard flats using the same technology. And we're also building roads. So the city has a big AZ Birmingham project that's currently underway, and we're using the same technology. And you can see these are pavers which a developer by the name of Garden Cities has also used in curbs and channels and things like that. We can also do toilet enclosures and your staircasing as well for homes using the same technology. So in a way, the province is also in the process of testing the technology in one of our development where we have 386 homes that are being built. So we'll see what the results come back saying. And then, yeah, there's a lot that's obviously going on, and you can see there's also prizes up for grabs, which keep our learners on their toes, especially the primary school learners. And then I just want to try and squeeze in, this is a educator at one of the schools, and then I'll end after this video.
Good afternoon. My name is Mr. Daniels. I'm in charge of the recycling on the school. I'm also in charge of the prefects who will then make up my recycling team. I will show you them in the video a little bit later, but I just want to show you what we have done with your container that you have provided. So this is not just a recycling center for us. This is our STEM lab, our recycling lab, the place where we store. We had very limited space on the school, so this actually is now a multi-purpose venue. Okay, so I'll just bring you inside. We did some conversions. We put in some power. We put in a nice aircon, some lights, and a storeroom over there. And then over here we've got our multi-purpose tables. So for these, what we've done is sometimes we want to recycle, and then we can lower the table, as you can see. So now you can open up the whole space by lowering all the tables, and you can have your different activities here, unless you need the tables and the chairs, and then you can just simply pull it up and lock it into place like that. So here you can see we use it for our gardening club. We have a few posters. We're busy building a full garden on the school. We're also using it for our STEM clubs, where we come in and do different experiments, and all of our equipment that we use for the gardening experiments and for the recycling is in that storeroom over there. We do have some trainings where we map out what we're going to do and how we're going to do it, and I'll go through our meetings and our problems here in this space.
Yeah, so that's the agenda I wanted to share with you all. Thank you, and thank you for having us.
Thank you very much, Ron. Zaid and Nazreen have responded to the questions that were posed on the app. And we also want to say thank you very much for the positive comments that are coming out on the app. Dr. Slapelo is sitting in front and he kept on nodding. That was a positive feedback that we got. Just want to read two feedback from when Ron was presenting, and in that time also asked Mabatu to be ready for the raffle, and then thereafter the raffle will have Lindane doing the vote of thanks, and that will be the end of today. But Ron, the feedback, interesting presentation, the projects done are heartfelt. And as I said, you remember the design thinking process, that empathy. The picture that he took when he was walking next to the beach and seeing what he was seeing, reading what he was reading and saying, this has to change, it can't continue that way. And someone, I won't mention the name, she says, you can't teach a hungry child. Some of us can relate. Thank you for ensuring that children in schools are not hungry and are also creating work for our parents. I think that was one of the most powerful things about this project, where you look at different elements that are linked to this project, and the students themselves at the end, they've seen, you've reflected a bit on it. He's not telling us the full story. The interest in proper maths and not maths lit, and all those STEM subjects, that is now going into the rise, because the last video that you saw, that facility is managed by students. So they bring in, you saw the plastics that he was showing, learners bringing plastics from home, the granny sending on the WhatsApp, community WhatsApp group to say, on Thursday, during 10 and 11, I'm available, please come and collect. And now the community is now giving back to the school. That is very positive. I'd like to call on Mr. P.S. Conrad, our AED. Look at him, Pa, to come and present the gifts to our speakers and to say thank you very much for the presentation. There's been a lot of interest. I noted someone saying, can this project, Ron, that you were presenting, can this be done in Atteridgeville? There's the project. Replication program is there. We need you to assist us. And lastly, all I want to say is that there may be elements from all these different presentations. It doesn't mean it needs to be in the very same sector, but you can take those elements and go and implement them in your own environment. So it's not a copy and paste, but you can further customize them. Over to you, Pa. So we'll start with the lady, being Women's Month. That's our token of appreciation. There they are. Okay. How you go back to the Western Cape with it, it's your problem. Great. Okay, Mabatu, can you come through for the raffle? And thank you once again for staying until the end.
here, I have a list.
Where's Mr. van der Walt? Going once? Are you here? Can you please come to the front? You open. What are you going to give him? He's the one who did a lot. Okay. Oh, okay.
Good afternoon, colleagues, ladies and gentlemen. Okay, this is the Huawei raffle. We've got 5 prizes to give. I'm just going to call the first person on the list, Majuta Mamogale. Are you here? Going once? Going twice? Okay, Majuta, sorry, I'm passing. Mutakalo Nechizumbewa. Huawei. Yes. Mutakalo, are you here? Okay. Is this one here? All right, next one, Tebatso Chokwe. Why am I hearing her? Is he gone? His name is here. Okay, going once. Going twice. Do we allow for people to take for the other? No. Okay. Kiriboni. It's here, you can come and check. Is it here? It's here. Okay, next, Thabo Ditsila. Thabo. Thabo. Going once? Twice. Okay. Zwelithini Kabela. Going once? Zwelithini, are you here? Twice? Okay. Sanilsiwe Butegezi. I think it was supposed to be Butelezi. Okay. All right. If we can have Abram Sefotlan. Abram. Next one is Maitele Kate Ratombo. Okay, so there is the Huawei. Yes. And we have five more to give from the CPSI. And we're going to be looking at the app for the best questions, the best engagement, the best comments. I don't have it.
We should have analyzed this.
Yeah.
Do a random selection.
Okay, the comment says, this initiative will enable the communities to be environmentally aware and bring to their attention the importance of proper disposition of waste and reduction of pollution through recycling. Hopefully other provinces will copy the initiatives presented by Western Cape. You know who made this comment? The owner of the comment. Please come. I want to see if you know yourself. Are you coming? Is it Mr. Jabulani Baloy? I need an ID.
Okay, the next one. Someone is from a small water department and they are glad to see the water cleaning as water is life. Also the rainwater harvesting and using that water for irrigation. It's a practice that we all have to practice. All right.
From a different platform, from a different group, which was your DM.
Yes. It would be the first one.
Yeah.
Why am I not seeing the DMs one? Did we give this one? A great speech, Honorable Deputy Minister. Indeed, we are here to listen, collaborate in finding solutions to improve service delivery through innovation that is inclusive. Poppy, Miss Poppy. Again. Really? Oh, you got the Huawei one? No. Okay, no, I can't give you twice, sorry. Sorry. Does CPSI staff get? No. Oh, sorry. Okay. I like the phrase you used about humanity can never be replaced by AI. Again, you highlighted the importance of young people in innovation. How can government move beyond consulting young people and give them a meaningful role in designing and implementing solutions? What is this name? Stephen Malema. Right. Mr. Stephen, are you here? Okay. And the last one. I love your slogan, which I'm going to copy. Distance is opposite to sympathy. It speaks to current situation and speaks to us as public servants. Veronique Ndlovu. Thank you very much. That was the last one.
Okay, thank you, Mabatu, for that. May I then call on Lindane to come and do the vote of thanks.
Good afternoon, and once again, colleagues. My colleagues always do this to me, that I fight with you and lunch, but I'm gonna be fast. Although it's a 2-hour speech, sorry. So, we'd like to thank, and we are grateful to our partners and host, the Office of the Premier in Limpopo. Did I say it right, Pierre? I'm always laughed at the office because I do Limpopo. They say I have a difficult Zulu tongue. I would also like to thank our minister and our DM, the Premier of the province, obviously represented by the MEC Finance yesterday. We're very grateful, and the MMC who was able to give a speech on behalf of the mayor. Our ADG from the Department of Public Service and Administration, our special recognition to Dr. Sitlapelo. Thank you very much with your team. It has been a very great partnership, and your support was very great. We appreciate it very much. All our CPSI colleagues, particularly our conference convener, welcome, and his planning and logistic team. I'm not going to name each one of them. Our speakers, presenters, our international guest, our Namibian guest, from the Office of the Prime Minister in Namibia, our great sponsors, our brave innovators who came in here and presented and shared their experiences. We thank you all for gracing this 20th Innovation Conference. We're hoping we will have another 20 years again coming of this similar event. Thank you also for coming and making sure that you learn and you go forward to innovate. It's a Friday, at least you're not gonna wake up and go to work, except obviously for the doctors, sorry ladies, but you can eat as much as you want and be able to go home and sleep it off, all the learnings you had today. We thank our service providers. We know we're gonna pay them, but we thank them, they did a good job. The venue, our AV, everything, they did a good job. No, we know we're gonna pay, but I mean, you can pay for something worse, eh? But this time we thank them very, very well for the good job. So ladies and gentlemen, that brings us to the end of this 20th session of our Public Sector Innovation Conference. I wish you all the best and thank you very much for being a good audience. Lunch will be served and you can leave at your leisure. Please drive safely for those who are driving. Thank you very much. Enjoy the rest of the weekend.